looking for something that is more curative, of fixing the root problem versus taking a pill that's masking the symptom. I think that there's starting to become a big shift with our population that is seeing the pharmaceutical companies. It's not the answer. You're not fixing anything. And regenerative medicine is becoming more of a standard of care as we move farther into the future.
Pain is just simply the stagnation of blood flow in your body. And so by putting acupuncture needles in specific areas of the body, it just influences the blood flow. Just getting the blood flow is going to help heal a lot of the pain conditions that people have.
It's one thing you could say it's a placebo effect, but it's placebo effect when you create an expectation. In this case, there was no expectation. These are unanticipated benefits. So I started looking saying, wow, there is something maybe more global that's happening in the body that's more part of the story.
I'm not going to have expectations. I just like to see some of the pain gone. I mean, I live in constant pain 24/7. I do anything and everything trying to ease the pain. I've been on painkillers for 15 years. January last year, I started weaning myself off of it against my doctor's orders because the pain is so intense. But I'm trying to live with the pain, and it's not no fun. You got to work, you got to make a living. They want me on disability. Can't do that. Can't live with disability.
Welcome to episode 2 of Pain Revealed. Thank you for being here. Very excited to continue this journey with you. And as you know, we're on a very serious and significant mission to give new ideas, new hope, and new vision to people who are struggling with acute or chronic pain. And I have to tell you, the information that we uncovered through this journey was earth-shattering. Things that I couldn't have anticipated or expected, but in the end what that translates into is hope for people. So if you haven't already, please join us in this mission and share Pain Revealed with other people. Let them engage in this content also, so hopefully it can change their life too. Episode 2 is a great episode with lots of wonderful information. Let's dive right in. When I walked into Dr. John LIEURANCE's clinic in Sarasota, Florida, I was extraordinarily impressed, not only with the technology, but also with a bunch of these paintings on the walls, which were very vitalistic and very alive. And I come to find out that the painter was Dr. LIEURANCE. Dr. LIEURANCE is not only an amazing and very knowledgeable clinician, he's also an artist. And when you really think about it, all of this procedure, all of this process, all of getting this care to patients is an art form. The presence of Dr. LIEURANCE is something where you feel that somebody is there who cares, who's knowledgeable, who has studied, and wants to get results with you. So I'm really excited to bring you into the world of Dr. John LIEURANCE. So John, I've been waiting for this interview. I've been here for 2 days looking at what's going on around here, and then suddenly jumped in myself and was involved in what's going on around here. As we've been exploring this subject now for quite some time in Pain Revealed, and a lot of it has been around cell therapy and rejuvenation type approaches in care. You've really assembled something that is kind of unique here with a lot of fun toys and processes that people are pretty much raving about. So you're a chiropractor. You started life, I think, as a chiropractor, right? So let's talk about your journey. I mean, how'd you get to where you are and what you're doing today?
You know, I had an injury. I had severe back pain early in my chiropractic career, and it was really a career-ending injury with a car accident. And a colleague of mine had just gotten out of osteopathic school, and he was doing something called prolotherapy, which I'd never heard of. But he promised me that this was probably why I had back pain, even though my MRI showed I had this massive herniation that was pinching on the nerve, and I had pain down my leg. So it was, you know, it really matched what showed on the MRI. But he started to talk to me about how pain can be referred by connective tissue. And he started to talk about how this treatment of prolotherapy created healing events in connective tissue where joints were maybe hypermobile. And I kind of stepped back and said, well, you know, in chiropractic school, they told us to stay away from hypermobile joints, right? You're to adjust the areas that are locked up and fixated. So it really made sense to me that if you can treat the hypermobility, that would be a very complementary, you know, modality in any practice. Sure. But at the moment I was skeptical, you know, and so he told me, hey, listen, let me do a treatment on you. There's lidocaine in this injection. I think it's these set of ligaments, and if it gets rid of your pain, that's pretty much diagnostic. That's where your pain was coming from.
Right.
So, you know, I laid on the table, he did the injections, and the pain went completely away.
That fast?
Just, yeah, because the lidocaine was, you know, activated in those ligaments, and so it was not involved with the disc at all.
Wow.
So that was really one of the earlier aha moments for me, realizing that there was something, you know, beyond just chiropractic that could be a huge benefit to, you know, my patients. So I've had probably close to 20 different doctors over the last 20 plus years working with me and for me, doing regenerative injection, and it's just evolved to where we are today.
Wow. Now, what's interesting, because there's some more facets to you, you know, I walk through this office and there's artwork hanging everywhere, so you paint.
Yeah.
So you have this inherent disposition towards art and aesthetics. Do you feel like somehow that translates into how you organize this clinic and, and the patient care that you give?
Well, I think that healing is an artistic expression, you know, and I think there's an intuitive aspect of healing. And sometimes, you know, an earlier teacher told me his definition of intuition is the ability to respond to low threshold input accurately.
Yeah.
You know, the key to that is accurate.
Yeah.
And sometimes you don't know where that intuition's coming from. It might be the way a patient's walking, you know, or the way that they're antalgic or kind of off to one side, or there's something that they tell you, and it just all these subtle cues, and you're following your intuition. You don't realize that there are very specific things that you're picking up on that are leading you to those, you know, ideas that might involve, you know, a various treatment plan that might work for that patient.
So I bring this up for a reason, because you said healing, you know, there's an art to healing. And so often people are looking at kind of an A to B direct link between, okay, here's this intervention, here's this outcome, and there's this thing called a person in the middle of all this. And you kind of said it, you know, there's just things that you pick up that might be subtle that will influence your thinking. It's not like you run a production line through saying, okay, everybody comes in, knees, backs, shoulders. It's like there's a little bit more nuance to this, and I think that's a part of what I noticed when you're thinking and approaching your patients. So is that something that you can train, or is this something you are?
Well, I think that there's going to be some people that are going to have it, and some people aren't. You know, it's like, you know, the artwork that I do. You know, sometimes when I'm looking at my art and I'm painting, I just think anybody could do this. Like it's a matter of just, you know, wanting to do it and having the desire. But ultimately, I think everybody has a unique set of skills that can be expressed depending on where they're going to put their efforts.
Right.
You know, for me, it's healing.
Yeah, and I think in the end, it's the fundamental thing. It's not it's healing, not a procedure, but healing is the thing that you're after with this, right? So now, looking at your background, you also went and did some additional postgrad training in neurology. What did that teach you?
It taught me that we're a very complex being, you know, and there's a lot of complexities with regards to the nervous system in particular, and how the nervous system controls so many aspects of health. And many things that I once thought were really more structural really are more of a neurological consequence. And I'll give you an example. You being a chiropractor as well, you probably would remember if you're working on a patient and you're like, relax, and they just can't quite relax.
Right.
And, it used to get very frustrating because you're like, well, why can't that person just relax? Because they need to be relaxed to get a very smooth adjustment, like on their neck or back. Mm-hmm. And so starting to learn about and delve into the neurology component, you start to realize that there's a vestibular component. Mm-hmm. And there's a conversation that happens between the inner ears, the eyes, and the neck muscles. Mm-hmm. And it's a very complicated conversation that needs to be very well communicated in order for, if you think about it, you turning your head to the right, the eyes move to the left, the inner ears, the position of the head. And so that gets confused, and then what your result is you have very tight muscles.
Right.
So working with the neurology, you start to learn that you can do some of these very subtle exercises with people to rebalance those things and get this supple aspect of the spinal muscles that then the adjustments are like butter.
So with that understanding, and then looking at the varying modalities that you offer here, there's quite an array. And having now been on the receiving end, getting exosomes through an IV push, but then next thing you know, there's a laser, an optic filament that will conduct laser light put into the IV that I can literally see glow through my arm from under the skin. Yeah. So why do you use that? What's that about?
Well, LumiStem is an opportunity for us to directly laser cells in the body and bypass the skin. Mm-hmm. And the skin was really designed to reflect light. It's to protect us from the sun.
Right.
So most of all of the laser light would be absorbed in the first millimeter of skin. So although we use very powerful lasers to get some deep into the body, it's minimal by the time it gets in. But if you can bypass the skin, and say you wanted to laser like the bloodstream, you're going to have all the red blood cells and white blood cells and cytokines. They're going to be irradiated, and the various spectrum of these lights has some amazing, abilities to transform that blood into something much more healing and, quench inflammation, improve autoimmune conditions. If it's done in combination with exosomes, it can be very synergistic.
Right.
Where you get a more profound effect. I think we were talking before about the entourage effect, where 1 + 1 = 4. Right. So using different modalities in combination, I found to work better than each individual would by itself.
So I've seen that. I also see another device, they call it the 10-pass. Can you describe what that does?
The 10-pass, I think I briefly had talked to you about my personal journey with Lyme disease and chronic mold illness. I was very sick. And there was points where I was a very successful naturopath and chiropractor, and I had patients literally coming to me from all over, but I was sick.
Now let's talk about that, because you also studied naturopathy, and you have a degree in that.
Yes.
You seem like you enjoyed academics for some good part of your life, it seems.
I love it. I love to learn.
Yeah. So after being a chiropractor and also a naturopath, that's when you were sick. And this was mold or Lyme, both?
Well, at first, I didn't know. Probably it was a good 8 years that I was just searching, and people were telling me it was in my head, and so I got very hard into meditation. I was meditating an hour a day, and I just had no idea what was wrong with me, and nobody could help me. I went to experts all over.
What kind of symptoms?
Just chronic inflammation. I had joint pain that was just severe. It was crippling. And I wasn't really able to do much, activities. I was a kite surfer. I was one of the first people to start kite surfing on this coast, and we were doing jumps 20, 30 feet and spins and flips.
Wow.
And so I went from that level of physical activity to I couldn't do anything, and I had a weight about 150 pounds, zero fat. So I looked like I was about 60 years old.
Wow.
And a lot of people were really, really worried about me because, it affects your psychology. I mean, this is a documentary on pain, and I knew pain. Pain was my very close friend for many years, and I know how devastating it can be, and it can transform your personality, and it can become a huge block for personal growth. You know, if you want to put somebody in a position where they're going to revert to when they were a little kid,
Right.
you know, put them in a lot of pain.
Yeah.
Spiritual growth, very difficult. You know, if you're trying to focus on being right in the moment,
Right.
you know, and in your body, but all you can, you know, appreciate is pain in your body is very difficult. So I knew that for many, many years. And I remember watching people even just walk or run or doing workouts, and I'd be like, I can't imagine myself being able to do that. 10-pass is what brought me back. You know,
Really?
10-pass hyperbaric ozone. And I had done regular IV ozone, and I was getting results. And that's, you know, after I figured out my diagnosis with Lyme disease, I started to do modalities. At first, it was IV antibiotics, which were temporary, and then I would get sick again. And then I started to use the ozone infusions along with colloidal silver infusions that were very long. You know, these infusions would last for about 6 to 8 hours.
Wow.
And I had a PICC line. I probably had 5 PICC lines. You know, I would have a PICC line for a few months, and I would have it taken out. I would never pick another PICC line. And it was really kind of dolphining between feeling good and just feeling terrible. So when I started doing the 10-pass hyperbaric ozone, it really moved the needle for me. And 10-pass has a reputation as a modality that can really cure Lyme disease.
Wow.
And you know, for me, it worked great. That, along with some lifestyle changes, some dietary changes, some Chinese herbs, you know, it got me to the point where I was really knocking on the door of being normal.
Do you deal with a lot of people in your practice here that have Lyme?
I do.
Yeah. It's interesting
From pain to purpose.
Yeah, from pain to purpose, right? As my friend Dr. Pompa says. Is there a blessing in your challenge in the sense that now you have a better sensitivity to be able to help other people who are facing similar things?
Absolutely.
Yeah.
I mean, the best insight is to get it down in the trenches.
Yeah.
Really, there's so many different aspects of just disease in general, you know, and I see chronic Lyme and chronic mold illness as being an absolute epidemic.
Yeah.
You know, I think that there are a huge amount of diseases that people are living with that they have no idea that this is really at the core.
Well, let's talk about that for a minute. So what are typical, and you explained what your symptoms were, and I can't tell you how many times I heard this through this whole docuseries. People told me it was in my head. They couldn't identify what was wrong with me. I started to think I was crazy, and very similar as far as the pain was debilitating, and there's no quality of life there anymore. And then some got lucky enough to find someone who said, no, I got you. I know what this is. There might be a lot of people right now who are in that they haven't found their solution. They haven't been given that little bit of hope that can open them up to new possibilities. So if it is mold, if it's Lyme, you know, what are they missing right now, or what are the doctors are providing for them missing right now?
Well, I think most every doctor or healthcare provider would agree that inflammation is really at the core of just about every disease, you know, and when there's a lot of inflammation, there's a disturbance in the body's ability to maintain homeostasis, or oftentimes, you know, you'll hear me say you're either a swamp or a river, you know, so we want to be more, you know, clean, you know, things need to be bringing in the groceries and taking out the garbage, right? The cells need that, and there's various effects that stagnation can manifest itself with, and it's amplified to a huge degree with someone that has mold illness or Lyme, and oftentimes they'll have both because you just can't detox,
Right.
you know. And my personal views are that there's about a quarter of the population has a certain set of genes, and we will test patients for these genes, and they can't cleanse and detox normally. So pesticides, heavy metals, a lot of man-made chemicals, and then the biotoxins. And biotoxins can come from mold, they can come from Lyme, any type of microbial, you know, effect. And where that gets stuck is in the cell membrane. And the cell membranes don't turn over except every 2 years.
Right.
You know, so this basically, you know, you have the environmental influence that's coming in and it's hitting the cell membrane, and that's transcribed down to the nucleus.
Right.
And so that message gets skewed, and so then you have this, you know, inflammatory response. They call chronic inflammatory response syndrome. You know, you'd ask me what type of symptoms, you know, if it's in the brain, you know, that could be a unique set of expressions based on that person's genes. You know, it could look like Parkinson's or Alzheimer's. You know, Dale Bredesen, you know, a very well-known physician that wrote a book called The End to Alzheimer's. You know, he talks about the different etiologies of Alzheimer's, and one of them is infection. So this isn't just, you know, the chiropractors and the naturopaths, you know, beating their chest about, hey, inflammation's at the core of a lot of these degenerative neurologic disorders. You know, this is real stuff. You know, this is real science that's now showing that that's what is causing a lot of these beta amyloid plaques and tau protein and so forth. So neurological diseases, you know, could mimic, you know, an expression of these infections. A lot of inner ear conditions, arthritis, you know, especially arthritis that doesn't seem to go away. You know, it could be worsened with sleep and rest. Like, you know, normal arthritis and pain, you know, you can get massage and you can get modalities and it gets better.
Right.
But a lot of these kind of mold and Lyme pain syndromes, they don't respond like normal pain syndromes do. But they can be made worse with activity, don't get me wrong.
Right. So I noticed, and as you're describing some of these things, you also have hyperbaric oxygen here. So why that?
Well, we have a couple of forms of oxygen therapy. We've got the hyperbaric oxygen chamber, and we also have something called CSSAc.
I was in that yesterday, yeah.
Yeah, and the CSSAc is really the evolution of hyperbaric. You know, there's a very expensive machine. There's only 55 in the world.
Wow.
We have one here at the center, and these will alternate pressure. And, you know, we talked about being a swamp or a river. Well, there is no modality that's more powerful to move something called lymph. Right. So lymph is like your body's gutter system. You know, the lymph is a fluid that's a result of, so the blood's bringing nutrients to the tissues, right? And then out of the bloodstream into the interstitial space, the area around the capillaries, and the nutrients gets into the cells, and then all that waste products has to go somewhere.
Right.
And that's where it dumps into this lymphatics. So if I were to take away everything but your lymph, there would be a perfect, you know, hologram of you. And so the lymph is everywhere.
Right.
And so if you take and put you through alterations in pressure, it's very powerful to move that lymph, so moving you more towards being a river.
Has sort of a pumping effect, so it creates movement.
Yeah, and increases mitochondrial biogenesis, which is your body's cellular battery, which is the energy that you need to heal, you know, and maintain all the different functions of your body and your cells. So it does that, and it's been shown to actually increase your VO2 max significantly with just sitting in this pod.
I say it's passive. You're not doing anything, but you know, the technician who was there said, you know, it's like you just had a whole workout, and I'm like, just sitting here, and they're like, yep.
And it's perfect for people with chronic pain because, you know, a lot of our patients, they're not triathletes. You know, they're not Ironman. I mean, we do see those patients, but the average patient we see has a hard time going to the gym and working out because they're in pain.
Right.
So the CSSAc has been a godsend for us to be able to rehab people to the point where then they can start working out normally themselves.
And so you have cryotherapy also?
Oh, cryotherapy. Yeah. Love it.
I love it. You're excited about everything you do, which you should be.
Yeah.
So tell me about the cryotherapy.
Well, the cryotherapy, it's called whole body cryotherapy, right? And it's a chamber, and you get in this chamber, and your head is sticking out the top, and nitrogen gas swirls around, so you're basically only wearing booties and gloves.
Right.
And men are going to wear, you know, their underwear.
Right.
Women, it's optional. So you're practically naked in this contained area. And the air goes down to negative 250 degrees.
The air?
The air, 250 degrees.
What does that feel like? I didn't get in that yet, so what does that feel like?
It's very cold. It's very cold.
I'd assume.
But the good news is that it only lasts for 3 minutes.
Right.
You know, and you know, if you think about if you were put in a really cold environment, and you know, back in the day, we didn't have, you know, heaters and, you know, air conditioning. We can totally control our environment.
Right.
We had to take the blunt force of nature, and it's unimaginable for you and I to think about enduring a winter without these big coats and being able to go and sleep in a warm room.
Right.
But we didn't have that luxury. So the genes that we are naturally born with and we have are expressed to be able to buffer that cold.
Right.
And we do it by creating heat.
Right.
So let's say we were to trick your body to think that it was 100 years ago and you had to live in that environment.
Right.
And that's what we do in that 3 minutes. So, but yet you don't have to produce all that heat. So your body's then saying, wow, I've got all this extra energy.
Mm-hmm.
What am I going to do with it? Wow, this ankle needs to be healed. You know, the heart needs some healing. The brain.
So it activates some genetic expression that can be channeled toward healing.
Mm-hmm. So it's a systemic effect. Now, there are some local effects,
Mm-hmm.
right? Cold therapy is used in a lot of instances for reducing inflammation
Mm-hmm.
locally. But when it's done systemically, you get this systemic effect that really is a special effect that we like to utilize here, because when we start applying regenerative medicine, we're looking for modalities that can support that.
Mm-hmm.
We're looking to activate those genes,
Yeah.
so that person can really dig deep at a cellular level to heal those chronic injuries.
And so somebody with pain, you're going to reduce inflammation, activate these effects, and it could have their pain resolve.
That's
simple.
what we see
Yeah.
every day.
Yeah. Well, talking about what you see every day, so it seems that I've spoken to some of your staff. The results, as far as the percentage of people that really get pretty robust results here, is high. How are you seeing it?
I'm surprised when we have someone that's not getting results, but I make sure that those people are, looked at, and there's always something. I have the personal belief that we can heal every single person,
Right.
And maybe that's a shortcoming for me, and sometimes it causes me some stress because I'll be up at night in the weekend, thinking, oh, that patient, what could I do? Like
Right.
what's different, But I do believe if you can get the right combination and figure out exactly what that patient needs,
Right.
that healing is a possibility for everybody.
And that's the premise to start with, right? Is that it's a possibility, at least, for everybody. Because if somebody's hopeless, then why bother doing anything? So you have to start there. So you see yourself a bit of a safe cracker then. So what's the combination for this one to get it home?
Yeah.
That's interesting. Now, a lot of stuff that you have here is kind of new and innovative, right? So it seems like this field is constantly, I don't say shifting, but it's evolving. So how do you stay current? I mean, new things come on the market, like, okay, the CSSAc comes out. Okay, well, we're going to get one of those, and, there's not that many in the world, but this is something I like. So how do you curate for your protocols here?
That's a great question. I don't have a good answer.
Mm-hmm.
I think I've been lucky. I know that with my personal journey with Lyme and chronic mold has brought me to a lot of modalities. And I think that when you have the intention
Mm-hmm.
to find
Mm-hmm.
those modalities and you're looking for answers, you're a seeker,
Yeah.
these things appear. So, but I don't have like a recipe that I follow.
Yeah. It's just you're kind of on this journey, and you see where it leads, and it's could be somewhat unexpected.
Mm-hmm.
What's
Yeah.
the biggest surprise or unexpected thing that you've seen happen here in your practice?
We see a lot of elderly patients here, and we've had some patients up towards, late 90s and even 100.
Wow.
And some people might think that even at that age they might not have the regenerative capacity, and I'm thinking of one particular patient in particular, and she was 97, and all she wanted to do was walk the beach, and so we did one of our flagship treatments called Maripose, where we combined bone marrow and adipose and honey matrix, and it was her knees that were the primary, problem, and just hearing that story, that she was able to walk the beach, without her cane and without any assistance, I think that's surprising to me at the time, because, I think the limitations that we might place on people for their age or, their weight or, whatever limitations you might think of, I think can be overcome with, as we said before, the right, combination, to crack that safe.
Yeah. So does it keep you motivated every day? I mean, looking at the work you're doing, seeing the results, does that like get you up in the morning with a purpose, feeling like I can't wait to go see what's going on today?
Well, my schedule is a bit different than most. I'm up at 3:30, 4 o'clock every morning. And
by discipline, or do you naturally wake up?
I wake up and I'm excited. I wake up and I spring out of bed, and I like to take that time to. I have a hot plunge and a cold plunge, so I have a bit of a ritual where I'm a big fan of cold therapy. As we talked about before. So I do that, and I'll do about an hour of meditation. After my meditation in the morning, my mind is turned on, and I'm ready to get on the computer and start to communicate with patients and colleagues and searching different publications. And I get excited about learning more and seeing how we can make things even better than they are. I think that would be kind of my constant self-talk, is how can I make that better? And that really juices me.
Yeah, so a lot of what you're doing is considered, some people might call it innovative, some people might call it cutting edge, some people will call it alternative. How far away from being sort of mainstream do you think the type of work you're doing is, or do you think it's not there yet?
Well, certainly if we were to project ourselves 100 years from now, we'd probably look back at what we're doing now as completely barbaric.
Yeah.
I mean, look at like in the 1940s and 50s when the first joint replacement was done, right? That nobody thought that was going to work. Even all the orthopedics were like, that's ridiculous. And insurances didn't pay for it, right? But now it's the standard of care.
Right.
So I'm certain in 100 years they're going to be digging up bodies with these pieces of metal saying, look, what the heck were they doing?
Right.
For me personally, when I first discovered ultrasound-guided regenerative treatments, where we're able to actually see what was wrong, because I think that's incredibly important. You got to, see which ligaments, which tendons, which aspects of the joints are damaged, and then being able to guide the needle to the precise area. I had been paragliding in Hawaii, and almost, had a more severe injury, but it was to my wrist. I came down on a lava rock. Ooh. And back then I was doing a lot of traditional chiropractic, and anybody that knew me back then, I had a wristband on, and I tried PRP several times, and it didn't work at all. And then I had a colleague that was starting to play around with ultrasound-guided PRP, and she was a medical doctor from Los Angeles. And when I went to get the injection from her, she had a man that was doing the ultrasound guidance, and he turned out to be a chiropractor as well.
Wow.
And it worked great because it was guided right to the right spot in my wrist. So I never had a problem with my wrist since then.
Wow.
But it was my second big aha moment, because I'm like, this is the future of medicine. At the time, nobody really heard about it.
Right.
But this is like 12, 14 years ago, and now I'm looking around and it's starting to become more and more popular.
You're right.
Where people are starting to catch on. So I think that the average person out there is not okay with taking a pill. Right. I think that there's starting to become a big shift with our population that is seeing, the pharmaceutical companies, and the drug paradigm as it's not the answer. You're not fixing anything.
Right.
And regenerative medicine is becoming more of an alternative for people that will become more of a standard of care as we move farther into the future.
And you certainly have integrated with all these things, stem cells and now exosomes, that you're utilizing. How do you see that particular area unfolding in the coming 5 or 10 years?
If I knew that, I'd probably be a billionaire right now. I tell you, I did learn about exosomes probably a decade ago. I knew they were being studied, and now, they're available. They were completely unattainable, when I first heard about them. They were very exciting, the exosomes. So now we're able to source them, very quality, in very high concentrations in the tens of billions per cc.
I was going to say, I think you put 10 billion into me yesterday, right?
Yeah.
And a little laser light afterwards. And so it's pretty amazing that the technology sits where it sits. So is it happening faster or slower than you expected? Because you said 10 years ago, I knew about this. Now here you are, routine utilization. So do you think the pace is accelerating?
It feels like that.
Yeah.
Yeah, it does. It definitely feels like, because I think, like what I said earlier, is that the demand is there. I think people are looking for something that is more curative.
Yeah.
Something that's more of fixing the root problem.
Right.
You know, I mean, this is the chiropractic philosophy. You know, we've been talking that since chiropractic school, right?
Right.
It's like, you know, fixing the subluxation, you know, which is at the cause of the problem versus taking a pill that's masking the symptom.
Right. And the idea of regenerative thinking as compared to symptom manipulation, right? I mean, that's really the contrast, isn't it? So, you know, say, hey, you know, the body does self-heal, and if there's things that facilitate regeneration, I mean, isn't that what everybody would want? So it's really fascinating to watch it unfold.
Yeah, if you had a choice between a joint replacement surgery, right? I mean, they're going to basically rip your joint out of your body and stick this big hunk of metal, right? Extremely painful, you know, for probably a good amount of time afterwards in the rehab. And then you've got the disability associated with that, you know, versus an injection where you're sore for a day or two. And if the results could even be better with that injection, who wouldn't choose that?
Yeah.
It's a no-brainer.
Not to mention the severity of the drugs that you're put on to manage that pain and that whole road that it could lead you down, which is not a very pleasant thing.
And then, you know, what types of leaching of some of that material into your body and into your bloodstream, you know, and the effect that may have in the energy, you know, in the acupuncture meridians through the body. You know, there's just so many things that we don't know, and as we're moving forward into the future, we're starting to realize, oh wow, that wasn't such a good idea.
Yeah, so now we've had this conversation, and certainly thank you for letting us come here and observe all the different things that are going on. And tomorrow you'll be up 4 o'clock again, excited about this and ready to do it all over again. Doesn't get old, huh?
Now that I got your cell phone, you're going to get a text.
Good.
Hey, I got this great idea. What do you think?
Expect a couple hours before you get a reply.
Okay.
Especially because it's 2 a.m. to me where I live.
Definitely.
I might be awake actually at that point. Anyway, John, I really appreciate you taking the time with us and opening your doors and allowing us to really critically observe what's going on here. I really appreciate that.
Patrick, it's my pleasure. Thank you.
I really hope you enjoyed that interview with Dr. LIEURANCE. He has a special place that he's created to help people in his clinic in Florida, and I have to tell you that it was a very rewarding experience for me to be there. I'm somebody who really admires and engages in this sort of integration of Eastern and Western medicine, saying that the vitalistic approach to understanding how the body works and how it heals is something that's critical for the context of getting people to higher levels of health and life expression. Dr. REGAN Archibald has really impressed me with what he put together in his clinic, where he's marrying East and West together in a philosophy that is helping a lot of people. So I think you're going to really enjoy his unique approach and our interview. Regan, really excited to have this conversation with you. So we've been exploring pain quite intensively, no pun, and we really needed to get the acupuncture angle. Spoke to many of your patients actually and was really impressed with the types of reports they were given. And acupuncture seems to be a very effective tool to helping people who are suffering with chronic or even acute pain. So tell me about your background and how you got into this.
I agree. I mean, acupuncture is something that has solved the problem for many patients who've had pain. But I got into this because of a professor at the University of Utah. His name was Dr. Bauman, and originally my course was I wanted to study Western medicine, but I was dealing with a bout of my own back pain. And my professor said, Regan, you should go see Tao Tan, who was a really well-known acupuncturist here in Utah. And so I went and got treatments. I'm very skeptical at the time, but when I was able to finally lie down on the table, my palms were sweaty, the needles went in, and then when I got up just a few minutes later, Tao Tan said, okay, move your body. And so I started moving around, and he says, do you have any more pain? I said, no, my pain is gone. And so I was like, okay, I've got to spend some time researching it. And so through my own experience, I started looking deeper into it, and I found this study that the National Institutes of Health released in 1997, and that showed that acupuncture outperforms some of the conventional therapies for conditions like migraine headaches, tendinitis, low back pain, which was what I was suffering with. And so that's what kind of opened my eyes up to this ancient medicine, and I've seen phenomenal things with it.
What were you thinking about doing in your life before that experience?
Well, that was just Western medicine. And I just thought, well, I wanted to just practice medicine, just be a medical doctor. But I grew up on a farm in Idaho. I was exposed to a lot of chemicals, so I had my own health challenges. And I had to look outside of the box from an early age. I mean, I would go grab books on nutrition just so I could make the basketball team, the football team, whatever it was. I'd have to keep myself healthy enough. Otherwise, I'd have to be working on the farm if I didn't make the team. So
that's good motivation, huh?
Great motivation.
Yeah. So what is it that are the fundamental principles of acupuncture? And is there more than one school, or how do you see it?
I see all acupuncture forms work. Now, you can go to acupuncture conferences and they'll say the Chinese meridian therapy is the best, or the Tong method, or Dr. Tan. I mean, there's so many techniques out there. I'm personally studied in the Japanese art of acupuncture. It's called Seitai Shinpo. So I was the first American certified in this specialized branch of acupuncture. Seitai Shinpo means correct alignment acupuncture method. So we're very sensitive about where to put the needles to realign the spine in an individual. Similar to a chiropractic care, where the focus is on spinal realignment, my acupuncture method has been designed around that too.
And the fundamental principles being what, as far as the energies of the body, meridians? So what are the fundamental principles that support the practice?
I think if you look at it from more of a historical base, yes, having qi. Qi is what you can look at as that speech where energy and matter are kind of at that meeting place. And so there's a lot of, there's more material around qi than just calling it energy. But in your body, you've got these meridian systems, these networks. And if you can keep all of those networks open, it's similar to having all the electrical circuits in your house being able to fire properly. That's what acupuncture does. It helps reset the electrical system in the body.
And it looks as these kind of as communication networks, so that everything is basically communicating properly throughout the body?
Exactly.
So it's interesting, parallels are very similar in chiropractic with what you're talking about. What I find interesting also is you're saying there's more to qi than just saying there's this energy, which I think that's how people just kind of like almost offhandedly say, well, that's it's this energy.
Yeah.
But you said it's kind of the intersection between matter and energy in essence.
Right.
Can you maybe dig into that a little bit more?
Well, some Korean researchers in the 60s, a doctor by the name of Bong-Hong Kim, he looked at acupuncture and he said there's a science behind this medicine. And so he investigated with his team to see if meridians really existed. And what he found were these little tubules, and in these tubules he found that there's these microcells, or now we know them to be like stem cells. And so these microcells, when you were able to provide stimulus to those Bonghun ducts, is what he named them, which are the meridians, you'll actually see that there's an expression that takes place biologically within the cells. And so I look at it and I say, well, that place between matter and energy, it's like our bodies are constantly this expression of who we are in the moment, and our bodies are always changing. You can't put your foot in the river twice, in the same river. And so that's the same thing that's happening when a needle goes into the body. These Bonghun ducts get activated, and we have these cellular transmissions that take place. So literally, that's the energy that's causing the material changes in the body.
Now, I observe that there's maybe two, I don't want to say forms of acupuncture, but two areas of focus in acupuncture, and they can be in the same clinic, I'd imagine. One seems to be pain relief. One seems to be general health, wellness, life expression.
Right.
Can you kind of speak to those two applications?
Absolutely. I think if you look at using acupuncture just to treat pain, we can't get a person out of pain if we don't get them healthy at the same time. And so acupuncture has always been a medicine that is it's big umbrella in Chinese medicine. Chinese medicine is the most sophisticated medicine on the planet. You know, if you go back 3,000 years ago, they had more texts and more writing. They were more advanced than Greek medicine that we refer to a lot, Egyptian medicine. And so I think if you look at just acupuncture alone, it is one of those techniques that we use in Chinese medicine that can influence either health or get rid of pain. But pain is just simply the stagnation of blood flow in your body. And so by putting acupuncture needles in specific areas of the body, it just influences the blood flow.
So let's talk about that for a moment, you know, because there is sort of this, I guess I'd call it a philosophical view of pain, where some people look at pain as the problem. Right. They're saying, hey, you know, we're at war with the pain. We have to beat pain down or numb it or what have you. You know, kind of conventional Western thinking. Yeah. You know, take medication, numb your body to it, put it to sleep, you know, if you can, so you don't experience it. Right. But the way you're describing it, it sounds a little bit more like pain is there and it has a purpose in and of itself that shouldn't be ignored. So can you speak that out a little bit? Absolutely.
You know, I don't even think we understand what pain really is, because, you know, we can look at one person who has chronic pain, low back pain, we'll take that for an example. You run an MRI on them and it says, oh, wow, there's nothing that we can find that would indicate that you have pain, therefore it's all in your head. You take another person who's got, you know, bulging discs, they've got stenosis, they should be in incredible amounts of pain, and they have no pain in their low back. So I think if you look at it from more of a perspective of blood flow and blood circulation, whenever there's pressure, you know, if I put a rubber band around my finger, that lack of blood flow is going to create a lot of pain in my body, right? You take the rubber band off and suddenly you're going to get some relief. And so I look at pain, and that's how acupuncture is. Treating pain in that perspective is a way of just releasing the blood flow in the body. Of course, you can dive into the chemicals in the brain. Those things are important too. But I think in just a very simplistic manner, just getting the blood flow is going to help heal a lot of the pain conditions that people have.
So through the lens of an acupuncturist, if someone has been dealing with either acute or chronic pain, and you know, they've been taking a bunch of drugs and they're a little bit you know, lost or maybe even desperate, you know, at a point in time where it's really impacted their life, they're starting to get depressed, what have you. What is it that they should come to understand about their circumstance?
I think the biggest thing about what pain does is it's an opportunity to learn where you're resisting in life, life flow. And so you may be resisting some change that's going on, you know, psychologically, a relationship you need to get rid of. It could even be a change like, hey, you need to change the way you're eating. Because what we've done at my clinic with over 60,000 patients we've treated is we put them on a cleanse. And we find that when we clean out the body, half of those patients, their pain goes away. And so it's just, pain is one of those indicators that it's time to make a change. And it could be professionally, it could be spiritually, it could be something as basic as nutrition.
So that's interesting. So basically the idea is if you're in pain, it's telling you that a change is required. It's trying to motivate some kind of a change.
Right, exactly.
And then if you start to numb the pain, then you're ignoring the change that needs to happen, which probably would create more pain, I'd imagine.
Exactly, yeah. The growth opportunity is in the pain. So that's like the silver lining is you need to lean into that sword instead of, you know, retract and retreat. And Western medicine has given us an awesome opportunity to just numb the pain, mask the pain, which is one of the reasons we have an opiate crisis yet again.
Well, interesting. It's that, you know, yes, there's times with that kind of intervention, you know, standard drug intervention is probably worthwhile as a stopgap measure.
Right.
But the idea of what you're talking about, I mean, some people might say, well, this is crazy talk. You know, I'm having trouble at work and that's going to equate to pain. Well, I remember reviewing some literature that the number one predictor as to whether or not somebody would have low back pain was job satisfaction. It wasn't degeneration in the disc. It wasn't any of the things that, you know, that were the mechanical things you spoke about. Job satisfaction was the number one predictor of pain. So it's not really crazy. It's actually, you know, well researched and known.
Absolutely. But how often do doctors ask, how happy are you with your job?
Right.
And, you know, I think if we just start framing our conversation around pain differently, I think we'll find far more solutions than what we have right now.
Now, I just heard you say something that maybe said wow. Did you say 60,000 patients that you've seen?
Not me personally, in our clinics.
In your clinics,
yeah.
I know there's 4 clinics, right?
Yep.
So 60,000 people. So you have to, that's a big enough population for you to just in your own sphere, your own universe, to make these types of observations and start to learn from them. Right. What do you feel like you know now that you maybe didn't know 15 years ago when you were practicing? Like what has emerged from you in the way of wisdom from having observed so many cases?
I think the biggest wisdom that I've observed from it is that pain is an opportunity. And I think that's probably at the truth of what I've seen. It's an opportunity for that person to really start moving towards a better life. And so for people who are watching this, who are in chronic pain, I think if they can just start looking at it as what can I change in my own life, in my own physiology, in my own psychology, that's the beauty of it. There's no one person who's going to just magically take your pain away. Right. I mean, that exists. We can take it away, but really it's that growth of an individual, the evolution of their process is the biggest thing I've learned.
And as far as that process, as you call it, so it's more like a journey than saying, hey, there's this one event. Yeah. Some of your patients I spoke to before sitting down to speak with you, I want to talk to your patients first and kind of get their feedback. But before speaking to them, before speaking to you, I know some of them have been coming in like 10, 15 years.
Oh, yeah.
So what brought them here in the beginning was whatever their pain or challenge was, that they were looking for a solution, and maybe a more natural or alternative solution to what was offered prior. But then I'm like, well, you're still here 10, 15 years later. And they're like, not because we still have the pain, but because there's other benefits. So speak to that if you can.
Well, I think, if you look at health as a constant transformation, I tell my patients, if we can get you 1% better every day for 100 days, and then let's start over again. And then we'll do it again and again and again, so that health never ends. And so the transformation really occurs when people can dive in, they can get the right tests ordered. So we want to look deeper into what's going on internally, and then we want to give them the right treatments, and then we mentor our patients. The one thing that's lacking in the medical system that I saw when I was investigating it is I saw there's no mentorship. And health is one of the most complex things that we have. I mean, we have mentors in school, and we get our degrees, and we invest a lot of money in that. But too many of us are not investing in a mentorship program for our own health. And so I think that's why people keep coming back, because they learn something every time they come in about their own health.
What's your favorite part of what you do?
I don't know. I love hugging patients in the waiting room, just seeing how they're doing, and I love seeing people who I saw them when there was no hope, and we're usually the last resort, and I just really appreciate my patients, and what they can do for me is just the hugs, the gratitude is my favorite part.
Now that's interesting because it's true. So often, in my experience when I was in chiropractic practice was, I wanted to put a sign over my door saying "Last Resort Doctor."
Right.
It seems like they've been everywhere else, tried everything, and they're walking in hoping for a miracle. Yeah. Is that? I mean, it seems like you like the challenge of it, but is it also a frustration because they really should be showing up here first before they're doing more dangerous or toxic things, right?
Absolutely. Yeah. And I think that people are getting better educated now. I mean, we're packing around smartphones, and so we're able to research a lot more. And so we do get a fair number of patients these days that this is not their last resort. They said, hey, something's off and my doctor tells me my labs look normal. Can you take a look at what's going on in my body, and maybe you can discover something? So we're seeing more of that, but it is frustrating that there's not more people who are pointed in the right direction initially. We can save them so much time, so much money.
So has acupuncture in the past 10 or 20 years changed much, or is it pretty much the same practice? Do you see new things emerging?
Acupuncture is always an evolving field. We learn new techniques, we learn new ways the meridians work. I mean, the research that was done by Dr. Kim in the 60s, that research didn't take off until about 2006, 2007. And so now we're starting to see it in clinical applications. We're also seeing a lot more studies, like very grounded studies where we have sham acupuncture versus real acupuncture. so then we can outrule, get rid of that placebo effect.
Right.
We know it works on animals, it works on kids, so you can't argue.
Placebo an animal.
You can't, not at all.
Right.
But I think just in the amount of research that we've had with acupuncture influencing serotonin, dopamine, that those have all been well documented. So I think we're moving in the right direction.
Now, I know also you have other providers offering other services, in the clinics that you guys coordinate care with each other.
Absolutely.
So what kinds of other things happen in your centers?
So we have traditional Chinese medicine, and that includes acupuncture. We've got practitioners who do functional medicine. Mm-hmm. Some of our acupuncturists are also functional medicine practitioners.
And functional medicine, if you just describe what that means.
It's basically where you look at the underlying cause through correct testing, and then looking at the body more holistically, how one system is responding to another system, and how that affects the function of the whole.
And does that usually, from the solution standpoint, involve nutritional therapies and the like? Okay.
Yeah, nutrition, supplements, herbs, all those things. And then the final piece is regenerative medicine. So that's where we do stem cell therapy, we do PRP, ozone therapy, we do vitamin injections, herbal injections, anything we can do to regenerate areas of the body that have been damaged or in a degenerative cycle.
So this is interesting. There's the old adage, when you're a hammer, the whole world looks like a nail. Yeah. So now you've got these different practices, acupuncture that you do, the functional medicine people, maybe herbs, nutrition, that kind of stuff is in there. And then you've got these people doing regenerative stuff. So a patient walks in and everybody says, no, they need what I've got. No, they need what I've got. No, they need what I've got. So how do all these people coordinate together?
Whoever pulls the hardest wins.
It's a tappy pull.
No, it's we look at every patient, and so all of our programs, we structure it under that umbrella where, we've got to get the right testing, now we've got to get the right treatments, and then we've got to have the right mentoring. And so health coaching is another piece. So just to add in one more piece, but it's where we meet together as a team, and then that's where, as a team, we can put together a plan that fits that particular patient.
And I think it's every patient's dream, saying, can there be some coordinated effort around my needs and my problems? So I think it would make people feel really great as compared to saying, hey, there's a central ego, that says I'm the guy or I'm the gal, and we're going to fix you, and that if I can't fix you, nobody can, because that's an affront to me. Right. And that's pretty, having not only been a doctor but being a patient, that's kind of a disturbing circumstance. Yeah. So what's it like when you guys get together and discuss a case and try to coordinate on it? Maybe give us a feel for what that's like.
It's pretty simple, because we have the standard tests we want to run on every patient. It's very easy to kind of predict what types of treatments they're going to need. And then our health coaches have a very standardized flow that they take the patient through. And then the patient, it gets individualized based on what's going on in that patient. So when we get together and we sit down, we'll say, okay, what's going on with Bill? And then we say, okay, well, Bill's got osteoarthritis in his right knee. He's got migraine headaches. He's got digestive issues. Okay, what tests are we going to run? Well, let's look at his labs for hormones. Let's look at his genetics for nutrition. Let's do a stool sample to see what's going on digestively. And then we all kind of, once the labs come in, then we review those together, figure out a game plan for Bill, and then execute on that. And so it's all orchestrated, and usually it takes several months to really execute fully on our plan. But when a patient goes through it, our end goal is for them to have their health independence. Right. So we say, look, Bill, you're no longer dependent on us for your health, or a medication, or a surgery. Congratulations. And so it does take a team.
And that's interesting, because I think identifying a goal is important, and there's a big difference between health freedom and provider dependence, saying, well, you're going to need me the rest of your life. Yeah. And in a sense, if you look at people taking blood pressure medications and so on, it's like, oh no, you're dependent on this for the rest of your life, as compared to saying, the path that you want to choose is one where you have health freedom. You don't have this dependency outside yourself.
Absolutely, yeah. And that's the type of people who we work best with. We tell them up front, hey, this is not about us just getting you the right prescription or playing guessing games with your health by throwing a bunch of herbs or supplements at you, because people who come to us these days, they've gone through the natural medicine route, is what I find as well. And in natural medicine, it's like, hey, try this pathway. And so the patient tries it and they end up where they started.
Right.
You know, and they've taken all the herbs, the supplements, but no one took the time to really investigate deeply enough with the testing.
And is there sort of a sequence, like saying, okay, this person's come in and they've got bad knee issue, you know, and they were told by the orthopedist that, you know, this is most likely a surgical case. They want to do, you know, a replacement or some other type of surgery, you know, to help solve their knee problem. Maybe they don't want to have a surgery. And would you start with one of your interventions that's provided by the center, like acupuncture, and then maybe evolve to things like cell therapy, or, you know, how might that work?
Yeah, so it would be really the severity of the case. And so that's where our medical, you know, it'd be, we have Dr. Dearden, we've got Dr. Lawrence. It'd be where one of our medical directors would look at the images and decide, okay, this patient, there's no way we can get the kind of regeneration that's going to be needed with just acupuncture alone or just PRP. Let's try some deeper interventions, and that's where cell therapy would come out, and we've seen great response from that.
And I think this speaks to maybe the importance of individualized care. It's not like, hey, you've got a single algorithm or a single protocol, rather, not even an algorithm, but a protocol saying everybody comes in, they kind of get the same thing.
Yep.
You know, people come in and really you have to look at them individually, so there's no generalized answer as to what they need. You just have to look at what's going on.
Absolutely.
And as far as you're dealing with pain or dealing with patients with pain, or, you know, acute or chronic pain, what are you most excited about currently? What are you seeing that's really kind of saying, wow, this is really going in a good direction?
You know, if you would have asked me 10 years ago that if I'd be practicing medicine this way, I would have said, no way, that's way too far in the future. But what I've seen is offering what I call collaborative medicine, where we all work together, East and West, and whatever perspective, as long as it's good for the patient. That's what we're looking at. I think I'm most excited to see how much a person can change no matter how far gone they are. And so I love to see people get their lifestyle back in order, because it gives them their confidence back. And then I love the regenerative therapies, how they merge with the traditional Chinese medicine has been very empowering for me as a practitioner.
So do you think people, for the most part, and maybe even the general healthcare community, underestimates what the body's really capable of in the way of recovery or regeneration?
Yeah, and I think I'm just as guilty as the next person. I mean, I have patients who I try and talk out of procedures. I'm like, I don't know, you may need the surgery, and they don't want the surgery. And I'm always shocked to see the amount of recoveries that come even out of those people who we don't even believe they're capable of healing as much as they do.
Well, you know, it's interesting you say that, because, you know, some of the naysayers might say, oh, you know, they're just trying to, you know, sell this therapy, you know,
right.
they get a lot of money for it and they try to give it to everybody. So
right.
you will look at people sometimes say, you know, they don't seem like a good candidate, or the probability of success might be low, but they, you know, but I guess you're just kind of say, hey, this is what I see, and, you know, it's informed consent, right? You decide,
right.
Or you've seen cases, I guess, as you said, where people are, you know, you're saying, I don't know that this is the right thing for you. And they're like, no, I want to try anyway.
Yeah, exactly.
And how do you deal with that? So is it really you just giving the patient their options and them deciding, or how's the guidance on this?
Every time, I mean, we encourage patients to do what they feel best about. And I think they have to really take a deep look in, because I say, if you're going to work in this type of medicine, first of all, there's going to be commitments you're going to have to make to your own health. And we require nutritional changes. A lot of people have to change some habits that aren't supportive of their overall health. And if people are willing to do that, then we say, look, if you're only going to get 10% better, 20% better, we try and give them like realistic expectations. I'd much rather give somebody a lower expectation and really surprise them than not get the outcome at all. So it really is up to the patient at the end of the day of saying, yes, I want to move forward, and I want to try something that's, you know, it's maybe unproven as far as what some of the naysayers, like you mentioned, they want to see the double-blind placebo studies. But at the same time, The amount of safety that I've seen with it has been something where we have no problem helping them out, and so far it's been great.
And that's one of the things, that I was going to bring up is, the safety. So, acupuncture, obviously not a dangerous procedure, right?
Yeah.
Even the cell therapies seems like, they're, unless you're doing some kind of weird application of it, but for the applications that you're doing, no real adverse effects or dangers there as compared to, drug therapy, surgery, et cetera.
Absolutely, yeah.
And I think that plays into the thinking to some degree. It would be the risk versus benefit, right? I mean, that's got to be a part of the consideration.
Yeah, just like anything in medicine, there's always a risk. And so if someone says it's 100% risk-free, I mean, there's that's just not true. I mean, you are getting an intervention. But as far as have we seen anything with the regenerative therapies that we've done, with the cellular medicine, we have not seen any adverse reactions directly from that. Occasionally we'll get a joint that gets swollen from the procedure itself, but in general it's been very well tolerated. Acupuncture, incredibly safe.
Yeah. We've been generically, talking about pain, maybe acute, chronic, what have you, but more specifically, what kind of conditions, are walking into your office? Is it migraine headaches? Is it degenerative diseases? What kind of things are actually walking in here?
One of the things that surprisingly we see consistently day in and day out are thyroid conditions.
Thyroid.
Patients who have Hashimoto's or Graves', or patients who have thyroiditis, but they don't really know the cause, and the Synthroid's not working anymore. That would be a big complaint that we get. And the second most prevalent would probably be just osteoarthritis in the knees. I want to go ski again. I want to get hiking. I want to be able to bend down and pick up my grandkids. We work with a lot of patients who are tired of their knees bothering them. Spinal issues is another common one. Low back pain, neck pain, sciatica, neuropathy. These are all conditions that we see quite a bit of.
Pretty good spectrum.
Pretty good spectrum, yeah.
So, and you're mentioning skiing, hiking. Well, we're here at one of your 4 practices in Salt Lake City, and so that's why skiing and hiking, I think, is very prevalent here for what people want to do as far as lifestyle. So now, let's say I'm not in the Salt Lake City area or not near one of your practices, because I get this a lot also, where people say, well, how do I find a good chiropractor? How do I find a good acupuncturist? What's the right way for a consumer, who's distant from here, that is looking for this type of a solution? What's the right way for them to try to do their research and land in the right place? Well,
I think the best thing you want to look at is talk to your friends. Your friends are going to know a lot of people. We've also got a network of providers. I've got a company called Go Wellness. And Go Wellness is a group where we mentor, we train, we consult other acupuncturists all throughout the country. And so I'm happy to send some of the people who I work with, I'm happy to send their contact info to anybody who's looking.
That's great. So they could contact you and then you could send a referral for them in other places.
Absolutely.
Is Go Wellness something they can access online if there was a directory of practitioners?
Yes. So they could go to gowellness.com and then they can go to our practitioner page and they can find their state that they're in and get linked up with the right person.
That's great. Well, I appreciate you bringing this particular dimension to our series here, because I've wanted to explore this. I think it's an important part of it, and you really did a great and thorough job in presenting it, so thank you for that.
Thank you for having me. Really appreciate it.
People like Dr. REGAN Archibald are doing great things in the world. They're combining ideas to serve humanity on a higher level. So I hope you can see the distinction of what was brought forth in this interview and what kind of new possibilities it presents. Well, now it's time to show you how much we engage in our own work at Revealed Films. My partner and Revealed Films co-founder, Jeff Hayes, and I were in Florida, and we actually had procedures done on ourselves while we were there. So if we were going to do that, then maybe he and I need to sit down and actually have a conversation. So this is a pure Revealed Films interview with myself and Jeff Hayes. Well, I don't know whether to be excited or confused.
Or both.
Here's my partner and the producer sitting in the chair that I'm interviewing, but he's going to interview me also. And this is kind of a unique thing that we explored a topic and got very excited about it and decided to become subjects of the topic rather than being the people who are exploring it.
Great choice.
Yeah, okay, so I'll start out. So we've been on this journey for a while now on Pain Revealed, and we certainly spent a lot of time in cell therapy clinics and talking to academicians and clinicians and patients, etc. And I'll have to say that starting out, I might have been a little bit on the skeptical side, not negative, but just saying I don't know that there's much here. And now here we are with stuff wrapped around our arms, and we went all in.
Yeah, I want to challenge the word a little bit skeptical.
Yeah. I was a little more than a little bit skeptical.
Yeah, a little more, but and that's good, as you should be.
Yeah. So now we had some treatment done today. I mean, we received some of this for ourselves, so this has really gotten to be interesting. So let's talk about what you did today. What did you have done?
So I've had stem cells before. I had my shoulder done over a year ago, probably a year and a half ago. And the other day somebody was asking me about it, and I realized I forgot what it was like to have shoulder pain. And so now if I work out, so I'd say it's probably 10%. It's like a normal, but I mean, literally, it's been so long since it hurt, I forgot that it used to hurt. I've also done stem cells intravenously. Mm-hmm. But you and I both, as we filmed this time, and when I first started looking at this a couple of years ago, we were hearing about exosomes, and exosomes are coming, and wow, they're really, the newest thing. And we interviewed a lot of the developers and experts on exosomes, and it was the first time I saw you light up and go, okay, I'll get those.
Yeah. And it started making a lot of sense to me.
And so this today was like a buffet. I did intravenous exosomes, but also in the last year, I went to see a friend of mine who's a chiropractor. Mm-hmm. And he was feeling my neck, and he goes, I don't think I like this. Mm-hmm. And so he had me go get an x-ray. Mm-hmm. And he looked at the x-ray and said, I think now I want you to spend the $500 to get an MRI. Mm-hmm. And I went and got an MRI. And I'm lucky to have you as a partner. Yeah. You looked at my x-ray and my MRI, and there's just degeneration. I'm getting older, and stuff is I
would say the wheels are completely coming off. But the lug nuts are a little loose.
The wheels are wobbly. So you don't know this about me, but I've never been tall. Mm-hmm. And so I say I'm 5'6.5", and now I'm literally, once I saw my x-ray, I'm scared to measure how tall I am, because I've got the disc just gone. Things are touching that shouldn't be touching, right. And there's no chance I'm going to go have that have metal
surgery
put in there. And so this I'm really excited about. So I've had ozone injected in my neck, which can really help with regrowth, and I've done that a couple of times in the last few months. Mm-hmm. And then, so after the intravenous exosomes, then we injected my neck. I had my face buried in a face holder, so I'm not exactly sure where, but
I was watching. I watched for a little while, and I had to kind of like back out. It looks worse than it feels.
As near as I can tell, they injected me about 1,000 or 2,000 times. I may be exaggerating a little bit, but anyway, really excited for that. And then they just have a lot of other cool treatments here. I did the 10-pass ozone, and a lot of these things are just synergistic. They work together. But for me, my expectation is the big gun is the exosome, so I'm looking forward to see what happens.
Yeah, so you had the IV push, the intravenous push, and then you also had injections, directly into your neck and some of the affected areas. Yeah. So, and how are you feeling right now? Do you notice anything?
Well, immediately afterward, I was taller, and so I really don't. My neck's a little stiff on one side, but it was stiff when I got here. The 10-pass ozone makes you feel good, but as far as results in my neck or from the IV, that'll be. We'll just wait and see what happens. I'm hopeful.
Yeah. So, and the other interesting thing with your shoulder is that I guess it must have been gradual in recovery because,
for 3 months. For 3 months, I didn't really even feel an improvement. Maybe 2 months. It was like, well, that just didn't. And I've filmed people that, bam! I mean, the stem cells fixed everything.
Right.
And I've also filmed people that. Didn't much seem to help, and so it's running about, and this is not science, this is me observationally, it's running about 85% positive results and 15% not so much. I even had an ex-wife do 2 knees, and one knee completely healed, and not much results in the other.
Interesting.
So
That's about as good a control as you can have.
Yeah, I don't know. The same person,
same person, right?
Same day. So I don't know how to describe that. But it was gradual, and then it was just gone. Where and shoulder problems, where they show up for most people, and certainly for me, is in sleeping.
Yeah.
When you roll over and it wakes you up, so it interferes with your sleeping, and that just doesn't happen anymore. So we actually have some PRP left over in a tiny bit of the exosomes, and I'm going to have them put that in my shoulder tomorrow morning.
Yeah, because you had, what do they call it, the honey matrix?
Yeah, so I've never heard of that before, but they pulled out about 2 gallons of blood. Or I may be exaggerating. And they pulled out some blood and then spun that down and made the PRP, and they put that in my neck with the exosomes.
Yeah. Well, we'll have high hopes, and we'll see where this leads.
Okay, and now we get to turn the tables.
Okay.
So this really was, with your background, again, for me, using your own body to heal itself, or using this this is to me a natural form of medicine. But you have way more rules than I have. Probably in every area of your life. But certainly around your health and a philosophy. What caused you to be willing to try this?
It's interesting. It's very compelling when you hear, and these are the dots that get connected. You hear an academician talk about, here's the body of science related to this and how we develop this, and then you hear a clinician say, I used to do a different form of medicine or medical intervention. When I discovered this, I started doing this, and it's been the most rewarding work of my life. And you can see that they're enriched just because of the results they're getting with people and how they're getting them. And then the third dot is actually talking to patients. And I'm very convinced right now that there are literally people who would have died had they not had this treatment. And it's one thing to look at the orthopedic side of it, saying, hey, I had a knee problem, I had a shoulder problem. And a part of what was compelling is the fact that people who had these orthopedic problems were not expecting other things to improve in their body. They were literally came in for a specific localized problem, although they had these other organic conditions. And to hear them say, but then suddenly I was on dialysis, and I go back and get my kidneys checked, and they're functioning again. Or I was in stage 4 of COPD, and now I'm at 2. Or these other things, and it's one thing you could say it's a placebo effect. But it's placebo effect when you create an expectation. When you don't have an expectation and you start to see healing, that's a different thing. And incidentally, I'm a fan of the placebo. Hey, what's more natural than that? But in this case, there was no expectation. These are unanticipated benefits. So I started looking, saying, wow, there is something maybe more global that's happening in the body that's more part of the story. We get very targeted in our thinking about, I got a shoulder problem, I got a knee problem. But and I don't really have serious orthopedic type problems. As a matter of fact, for somebody my age, I'm doing really well. But when I started to hear some of these other benefits, and I'm definitely a general health and wellness explorer, I said, I think I'm ready.
So, and you are in good health and can mountain bike with the best of them. And what's your hope for this?
My hope is that I start to experience better energy levels, because I have noticed, in the past maybe 10 years, that trying to sustain the level of energy and focus that I would normally have through fairly intense days, being an entrepreneur my whole life and doing the varying things that I've done, I put a lot of demands on myself, but I was able to do it. Now I find myself saying, wow, it's a struggle to hold up some of the pace that I go at. So on the athletic side, as you said, I would hope for, maybe my endurance and some other things might improve. And I wouldn't be disappointed if it didn't necessarily. But I can tell you there's certain things that happen that people have reported that got my attention. For example, visual acuity. As you get older, there's a thing called presbyopia. Your ability to read. You need what they call reading glasses. And about 10 years ago, I had to start using reading glasses over time. I heard people say, "Hey, I didn't need my readers anymore." But to me, that's just sort of an indicator. Meaning, well, if that is because, as a friend of mine put it in a very sobering way, makes you wonder what else is going wrong inside your body that you don't notice, right? Right. So now the opposite could be true, saying, well, geez, if my eyes and my visual acuity is improving, my ability to read, I wonder what else is healing in my body or getting younger again. So I don't know that I have a specific symptom that I'm looking to dissipate, but the general sense of energy and well-being and my recovery periods when I'm working or traveling and having to deal with different time zones, that I'm hoping, or it would be really great if I found that, wow, I feel fresher, more energetic, and I can perform better.
Well, I can't wait to see what happens. What you were talking about, Udo Erasmus, we've interviewed, and he was talking about the dosing of oil, and the way you're taking enough omega-3s is your skin starts to get better, right? Because that's the last place your body lets it go. That right. means your brain has had its fill, your organs have had their fill, mm-hmm. and now we'll let the skin have some of this oil. And so I think if my eyes get better, I'm going to be like, I think maybe you got a chance more than I do of your eyes getting better, right. But that would really be a great indicator that everything else is doing well.
Yeah, and what excited me, at least today in my own protocol, was not only the IV push, but then through the IV putting in filaments that can conduct varying wavelengths of laser light, and looking at it was blue, red, and yellow, so the different wavelengths and the varying impact that might have hitting my bloodstream, circulating through my body. So the general, it's sort of like this is maybe an intuition to a degree, but the general themes of systemic exosomes, especially because they're non-nucleated, so we have no DNA. I don't have somebody else's DNA floating around. It's, they're more generic, I guess, and so they can be better utilized by the body. And then stimulating that with varying wavelengths of coherent light, and understanding that these things are innovations, to help reverse the aging process and create more youth and vitality. That's really what I'm looking for, and I'm excited about it. So it makes sense to me, abstractly, and I hope I have the experience personally.
Well, I'm looking forward to reporting back to you and hearing your report, and I'm exceptionally glad that Lori was here.
For my wife, this was a big deal, and life is funny sometimes. How blessings can just show up. That we started this project, and she was in quote unquote perfect health, and to see the type of stuff that showed up for her with this root canals that gone bad, infections, and having systemic issues and neuropathies, what she kept saying to me is, this isn't me. I mean, it's not aligned with my identity. It's not aligned with my experience of life. And suddenly there you are. So to have these tools available to us, through the research we've done for this project, and then say now it's become very personal, I look at that as a great blessing.
Well, another adventure.
Here we are.
Thank you.
Thank you. I have to tell you, sometimes this work can be really fun, and I so much enjoyed the ability to sit down in front of the camera with my partner, Jeff Hayes. Normally he's behind the camera, so when I can get him in front of it and we can have a little interaction, I think the audience benefits, and that means you. So I hope you really enjoyed our conversation. Coming up for you now, we're going to show you a procedure, and we're also going to talk to a couple of patients. So I have to give you the disclaimer, the viewer discretion is advised. Procedures sometimes for people can make them squeamish. So if you're somebody that can't look at some interventions or needles make you squeamish or that type of a thing, you might not want to watch the procedure. But I will tell you, I find it fascinating, and the interactions with these patients I thought was very illuminating.
Hi.
Hey there.
My name is Sue. I'm going to be your nurse, and I'm going to start an IV on you.
All right.
And so feel a little tight, and then I want you to make a fist.
All right. Don't be afraid of those huge muscles.
I'll try not to be. Okay. So let me just clean this off. Some ChloroPrep. Cold. And so what I'm going to do is draw 2 large syringes full of blood to make the honey matrix, which is like a scaffolding material because you're going to have some joints injected today.
So do you put the IV in and then use that?
Right, and I use that to take the blood out instead of having to stick you again.
Good.
With just 1 stick, which is enough. Okay, here we go. Pinch. You okay?
Yep. Yeah, I only agreed to the honey matrix because I thought they were going to give me honey.
Okay.
I fell for the oldest.
You
food
did. You
trick in
fell for the
book.
trick.
Yeah.
They knew it would make you sweeter. All right, here we go. Just.
Yeah, you're really good at that.
Thank you.
Thank you.
I think that's half the battle. If you think, you know, it's gonna. All right, so what we're gonna do, we got some coagulate stuff in here, and we're gonna just pull it. Right through the line. This looks like it's a lot of blood, but it really isn't. It's like 180. So it would be, we usually take between 320 and 340 for a unit of packed cells if you're going to donate blood. So this would probably be like a little.
Good. I have extra.
Half of that. You have extra.
Yeah, I make too many red blood cells. So.
Do you? Yeah, there's a lot of people.
Yeah.
So this will make you feel better.
Yep.
It will make you feel better. I have patients that come in and I take their blood off of them.
Yep.
Yeah.
I do that.
Yep. Mm-hmm. Okay. Yep. And they feel so much better. And your blood you'll replace. I mean, for you it doesn't matter, but for somebody who's concerned about if their body, it'll replace within a few hours. Well, you just need to make sure stay hydrated, but that is the key for everybody anyway, is to stay hydrated. Especially for us down here in Florida, people don't realize when they're becoming so dehydrated, they end up in the hospital left and right. Just unbelievably. Give them a little fluid and they're back to new. Okay. So second. I'm just going to clean that tip. And then I'm going to, you might taste this. It's just saline, what our body's made of. And I do a little to push the platelets through so they don't get stuck and make it clot. Now they're going to take that and process it. Okay, so what I'm going to do, just because we're going to be waiting a little bit, is I don't want this IV moving around too much. So I went down below your elbow so you can still bend your arm, okay? And then what I'm going to do is just wrap this up, and I'm going to put some, what I call my Coban, which is a wrap, so it's not, and you can still do things. Okay, so you're all set. So they're going to process that in the lab.
Yep.
And then it takes 20 minutes or so to get it all ready. And then when that's done, we'll do the both treatments together.
Okay.
All right. Very good. Thank you. All right, what I'm going to do is give you your exosomes
Good.
through the IV. So what I'll do is just move this and stick out my little tail.
There we go.
There we go. There it is. Clean the tip. And what I'm going to do is just give you a little half. Let it get in. Little half. And of course it's a hard one. Oh, there we go. All right, and then I'm just going to flush it. Might taste it a little bit. You shouldn't feel it really. There you go.
Well, I don't know if you can tell yet, but I think I'm a little taller.
You are? I can't tell you. You got to stand up.
Well, it'll be gone by the time I stand up.
Yeah. It's short-lived. All right, you're all done.
Beautiful, thank you. It's really more I think the arthritis on the sides.
Okay, yep.
Was it facets?
Mm-hmm.
Yeah, you want to use the lightest one possible so you still have a little bit of eye strength.
All right, my man, just a few little sticks here, okay? Little topical numbing medicine. So the exosome component was combined with the PRP and honey matrix. So we combine that all together and then inject. Okay, there,
Yeah, a little travel there.
into the shoulder.
And my toes. I think that was a...
Travel.
Yeah, just the sight.
Okay. So far, so good, Jeff.
Yep.
Normally, laser light is absorbed within the first few millimeters of the skin. So with this laser, we can run the fiber optic down through the needle, and it sits right over the area. So we can go deep into the tissue. It's called interstitial, or into a joint, interarticular with these needles. And it's regenerative as well. Really turns on the cellular energy, the level of the mitochondria.
Hi, Mr. Fairchild. I'm Dr. Just. Nice to meet you.
Of course you are.
How are you doing this morning?
I'm doing well.
Great, great. And you came down from Flagstaff this morning, correct?
Through 8 inches of snow.
Oh, well, you got here safe at
Yeah.
least, so that's good. That's
Yeah.
good. Well, Ashley was telling me you got a few different areas of pain, but it's mostly centered in your lower back.
That would be the number one pain.
The number one pain. What would you say is number two?
Left leg.
Left leg. And is that in the knee, just in the
whole
entire leg?
It's numb. It's what the doctor called nerve pain.
Okay.
And it's numb nerve pain because I don't feel the leg that well.
Okay.
It used to be 100% numb. I have to walk with cane or crutches.
So better,
It's
slightly better
yeah,
now then.
over years of therapy and stuff, but it's just taken way too long.
So, and the pain is constant then?
24/7.
Okay, and both the low back and that left leg, or the numbness in that left leg, or?
They are constant.
They are constant.
But my right leg is off and on.
Okay.
That's sciatica pain.
Yep, okay.
And then I have the pain in my neck, which is not all the time, but I
Okay.
get nerve pain shooting from my neck, out my arm, down to my fingertips.
Okay, and both arms, or?
Or just the right arm.
just
Left
right
arm is the only thing that doesn't hurt.
Okay.
Been on pain medication for 15 years.
Yeah, I saw that, and Ashley had even mentioned to me that you're starting to wean off of morphine?
I started weaning off of morphine in January against my doctor's orders.
Okay.
And so 3 months ago, I'm 95% off morphine.
Good, wonderful.
So I take them on Saturday night so I can sleep comfortably on Sunday a little bit.
Yeah. So how is your pain level? Has it changed with weaning off, or how has that gone for you?
Back then, the pain, scale of 1 to 10, 10 being the worst, was always a 7 or an 8.
Okay.
And with the pain medication, it would drop down to a 6.
Okay.
Right now, my pain level is between 5 and a 7.
You said, is the neck pain constant for you? No, so that's not constant. What does that feel like? Is it sharp, dull, achy, stabby?
Dull ache.
Okay.
But when it hurts, my arm hurts.
And is there an actual hurt then in pain in the arm, or is that none?
If I turn my head the wrong way while it's hurting, my right arm drops.
Oh, okay.
So I'm sure it's nerve. The arm's just hanging. I don't even feel it.
Do you do anything, or what do you do to
Cry
get
a
that
lot.
sensation back in there? Just something that comes back over time then?
It comes back. Usually within
Okay.
20 minutes it comes up, but then it's got that pins and needle feeling type. I had a 300-pound crate fall on me.
Ooh.
And it ripped according to them, took the tendons right off the bones. It looked like I'm flexing my arm all the time.
Oh.
And they waited 3 years to qualify me for surgery. So things got worse during that 3 years.
Oh, I'm sure. I can imagine.
Yeah, so,
Yeah.
and then a year and a half of therapy, and it never but I
Never got better.
pushed through.
Yeah.
So I can deal with this.
Okay.
Can't deal with the low back.
Yeah.
The other things.
The legs.
How's this for brain? I had concussions.
Okay.
I was in a coma for a while.
When?
So I have in 1963.
Okay.
So 5 years of recovery from that, never did recover, but I have trouble concentrating and thinking,
Okay.
along with dyslexia and ADD caused by
Yeah.
the accident. So I'd like to be able to focus
Okay.
better.
Yeah.
Didn't know that
that's
might help, because all the brain cells up here were dead after the accident.
Okay.
I wasn't even
Yeah.
supposed to be alive after
Yeah.
5 minutes,
Oh,
they
wow.
said. But this is, technology back then that didn't exist.
Yeah.
But
Oh,
I
yeah.
would like to think clearer.
Yeah. Okay. We should have some effect on that brain, or potentially could have effect on cognitive
If you can drop
function
the pain in
and
my
that.
low back,
Yeah.
I can be brain dead for a while.
Obviously, if that's the main area, yep, that's where we're going to focus. But we'll see what we can do for some of these other areas.
You're doing
as
the
well,
IVs?
too. Yep, yeah, that's basically what I mean. Yeah, we'll do basically a combination of direct injection to your low back, and then we'll do the rest through an IV, because that'll hit your neck. That'll hit, if we're treating the low back, that's going to take care of your legs, because I can guarantee you at least it's a contributing factor to what's going on in your legs. If it's not all of it, we take care of that. The legs start getting better. Then that can even go to then the IV can go to the neck. That can go to the shoulder, the arm, the nerves if there is some damage there. The brain, there is evidence that these cells, or the exosomes, do cross the blood-brain barrier and get up there through IV administration.
Yeah, because I was always worried I was getting Alzheimer's.
Yeah.
And they said no. And they said it was just from the accident.
Just from the accident,
Yeah.
yeah. A little post-concussive.
That's one thing, losing your keys.
Yes.
There's another thing, you wake up in the morning, who am I?
Yeah, yes. And we all do. I even say I go into the room and I forget what I went in there for. So if it's some of those more normal type things versus something that's more exaggerated, the low back bothering you a little.
Yeah, I even do this when I'm driving. I got armrest in there. I have to lift it up a little bit. That's why I lean a lot.
And so any specific movement worse for your back? Because I know you had mentioned like sort of going back to work or lifting helped you previously.
If I stay busy, I don't pay attention to it.
Okay.
But
So
if I
it's
sit for
maybe
5
more of a
minutes...
distraction that you're busy versus it's not in pain.
Yeah, so if I'm sitting, it's like, I need to do something.
Yeah.
So usually I'd be getting up, walking, pacing, something like that right now.
Cortisone was 5 years ago, the most recent one?
Yeah.
In the low back? Okay, good. Just always like to double check.
Yeah, I was doing
that.
2 a year, and it worked for about 2 or 3, 4 weeks max, and that was it. So I just quit doing them.
Yeah. Does it hurt you at night at all? Interfere with sleep? Mm-hmm. Okay. Prevent you from falling asleep, staying asleep, both?
I take Ambien.
Okay. Yeah.
I've been off of it for 3 weeks, and I'm doing all right now because I get up at 1 in the morning, I go to bed at 7 at night because I work till 5 in the afternoon.
Okay. Yeah.
But
with the schedule?
I wake up in the middle of the night with pain.
Okay.
And it's sometimes hard to go back to sleep.
Okay. But the Ambien does help you fall asleep?
Yeah, it's good for about 4 hours. Okay. That's about it.
Okay. Does the pain limit you in anything in your life? What?
Can't go jogging like I used to. Riding a bike's difficult. The bedroom activities is difficult sometimes. It makes life a little harder,
Yeah.
So I don't do the activity. I used to do rock climbing, hiking, bike riding all the time and stuff in the last 5 years now.
Okay.
Oh, I forgot to mention migraines.
Oh, okay. So suffering from some of those as well?
That's from the accident, yeah.
Okay.
It seems 3 months a year. They're like almost every day.
Okay.
But then they break down to like maybe once every 2 or 3 weeks.
Okay.
So hopefully that will help, because when I get them, oh my God.
Do you get
projectile vomiting?
Okay.
It gets real bad.
Do you get any of the flashing, like the visuals?
Colors in the corners of my eyes.
Okay.
Lights hurt, sound hurts.
Yep. Well, as I mentioned, just previously, and you asked with the, even the memory, the cognitive function, there is evidence, even just through the IV, that these exosomes do cross the blood-brain barrier and get up there. So, and we've even had patients in the past, we usually term them secondary improvements, because again, we'd be focusing on the low back
Yeah,
or
that's the main
lungs
thing.
or heart, but then they come back and they report eyesight improvement as well, hearing improvement, and that gets better. And that could be the first thing they notice, because it was minor in their case, where then the pain, it's just going to take a little while longer. We know they're affecting you. We know it's having a positive change in the body, but now it's just going to take time. And that's really what it is with everybody, that very commonly with joints, back, neck, those areas, 4 to 6 weeks is our typical average
Okay, that's what I was
time
going to
frame.
ask, the time limit.
Yep, for noticing improvement. Now, we do have some patients that call probably hyper responders, who in as few as a couple of weeks, they're already starting to notice something from that. But again, the majority of our patients, it's usually just a gradual improvement over time. It may take a few months. It may take upwards of 6, 7, 8 months.
What about side effects?
Very little to
And if
none.
there's little to none, what are those?
So yes, the main one would be that there is, and even in the exosomes, there's not a lot of the preservatives or anything, but I was just mentioning it, that there is sometimes a reaction with a preservative called DMSO, but you don't have anything in your allergies. It's just the
Oxycodone.
Yeah, shouldn't be a cross reaction, shouldn't be concerned about that. Other than that, we do see, again, we see about an 80% response rate. 4 out of 5 patients respond. So being the practitioner, I can feel comfortable doing this therapy all day long.
That was the question.
I'm not going to make anybody worse. Now, one of the things, because I know in your case you do some physical labor with your job, lifting and things like that, we usually do recommend taking it easy from those types of things for 3 days after the treatment, because we just want to give the back or the area, whatever it is that we injected, a little chance just to recover even from the injection. But it's going to be a little inflamed over those first 3 days typically. So we do want to give the body a chance to calm that down.
Okay.
And then we usually start building up just activity from there on out, all the way up usually to a few weeks, even a month, just depending on the patient's case.
So build up the activity, not jump back into it.
Yes. So yeah, that's just one thing. And again, it's not like, it's a lot of it's intensity typically. I know you mentioned weights, going to the gym, maybe not as much anymore. But, a lot of that is then restricting the weight, just restricting the amount that people are doing. Because, again, we do want to give it a chance to heal.
Yeah.
And then as we start to build up, because exercise does aid in the recovery process and in pain reduction, as you even mentioned from before, when you were starting to do a little bit more and lift a little bit more with that low back. So it's not like we want to limit you for too long. And again, you still have your daily activities. You still got to eat, bathe. But again, the main thing would be, the lifting.
So try to eliminate the lifting and heavy weights for a while.
For the next 3 days, mainly. Driving, fine. Again, if it's something that, because obviously I know you're from Flagstaff, you're up north, that, if it starts to get a little sore after an hour, take a quick break, get out and walk around.
Which is what I've been doing.
Yeah. So
just keep doing it. Okay.
And then again, I would expect that to just gradually get better. Maybe it's a month, maybe it's a month and a half. You're now able to drive from Flagstaff to Tucson without that starting. Or maybe it's right before you get to Flagstaff. Now we're at 2 hours or something like that before you have to get out. That it's different in every case. But again, most of them are just gradual improvements. And as long as we see those little steps, then we know you're headed in the right direction. And then ultimately it just becomes a matter of time until you start feeling like you're your old self, or, hey, I'm 90%
New
better.
self.
Yeah, I'm 90% better. Hey, if after 5 months that's where we're at, hey, I think you'd be able to live with that and be happy with that.
If you can get rid of 25% of what I'm still living in,
Yeah.
It's going to be high now. I've had 8 cups of coffee.
Oh, not too bad. A little bit higher than what you mentioned, but 97 and 69, so those are both good. There. And then you can just relax the arm yet for me, thank you. Over 84. And what normal for you?
When I had this much coffee, it is.
Yeah. As you mentioned, like that. So, how's the back feeling right now?
It hurts.
Just in the low back? There.
Left leg.
And then the left leg, but that's more numb for you, right, than pain?
Numb pain.
Numb pain, okay, yeah.
So the leg actually hurts worse than my low back, but...
Okay.
Because it's like a big ache on the inside of it.
Yeah.
But if you fix my back, this should go away.
That should go away, yes. Yeah. So straighten out the right leg for me, please. Any pain, discomfort in the right leg, down the right leg? Okay, so we're having some of that?
Just a little bit.
Okay. Relax that one for me. Straighten out the left leg for me. Anything there? Does that make that leg worse? Right in there? Any of the sciatica or
sciatica,
anything?
nothing right
Okay.
now.
So just on that medial or that inner portion like you just mentioned.
That I can feel that there, but the whole leg aches.
Okay. Both of them together for me, please. Does that cause some pain?
Yeah.
Same thing on the right, same thing on the left for the individual?
Yeah, and my back's hurting.
And the back. Okay. You can relax that for me, sir.
Thank you.
Thank you very much.
I haven't done sit-ups in a while.
And then I'm going to have you lay down for me, just with your head up on this end, on your back. Okay. And how is that for you? Does that hurt? Laying flat? Better with the knees bent?
Yep.
Okay, so I'm going to take this. We're going to start with the right leg. I'm just going to do a straight leg raiser. Does that cause any of the radiation down the leg?
Not yet.
Anything in the low back?
Not yet.
Okay. As we get up there, starting to a little bit more now.
Okay. A little bit more.
Okay.
No, it's still not.
Now it's starting to. Are we getting any stretch or anything in the
Getting
back?
a stretch
there?
in the
A little
back.
bit? Yeah.
But I got this over here.
Okay. Then we're going to come down, relax. We're going to bend the knee. And we're going to bring the knee up to the chest. How's that?
That's fine.
No problems there? Now I am going to have you straighten out this leg for me just really quick. And I want you to put this ankle across this knee and just let the knee relax there. How is that for the low back? I can just...
You already know.
In that right side in that area?
Yeah.
Okay, you can relax. You can straighten out that leg. And then if you need to bend your knees again, you can for me, Michael. Sorry about that.
That's all right.
Don't mean to cause you any more pain, but just got to get a good example.
You gotta get, yeah, I understand.
We're going to do the same 3 with this leg then. So we're going to go up straight first.
I don't feel it.
Okay.
Yeah, it's got that numb
Just
feeling,
maybe a little stretch.
but I can feel it in my back.
Yeah, okay.
But it
We're
feels more like a stretch in my back.
Okay, then we're going to bend the knee again. We're going to come up. Anything here?
No.
Okay, good. And then I'll have you just straighten that leg out again, just really quick for me. We'll put that ankle across. And that sort of that SI.
It's not the back, it's the leg.
Okay, down the leg. You can relax for me then. And if you need to bend those knees again for me, you can. Is that helping then?
Yeah.
Okay, good, good, good. I'll let you just sit there for a sec to calm it down.
One Mississippi.
And then if you need some help, we'll have you sit up then.
Pull me up.
For the next one, yep. And then this next one, I'm actually going to have you stand up because I'm going to demonstrate, but I want to see how far you can go through the motion without pain or anything like that. So again, I will demonstrate. So we'll start just on the right side. We'll take your right hand, place it on the back of your right leg, below your right buttock, and you're going to trace it down to the back of your knee, but I want you to twist to that side and bend backwards. And go just as far as you can before you do feel pain, discomfort, or anything. Right about there, Michael?
Yeah.
Okay. And are we noticing it right sort of in that area? Yeah, right in there. And just mainly on that right side, is it radiating down the right leg at all?
Yeah.
You can come up.
Took you long enough.
Sorry about that. And then left side for me whenever you're ready if you need to take a second.
That's about it.
That's about as far. Okay, you can come up. With that one, was it in the left side right here?
It was in the spine.
Okay. And then anything down the leg there? So right
No,
above.
not back in the leg. Just spine was hurting.
Just the spine was
Yeah,
hurting.
because that's where that spot is.
Okay. Did we have any pain anywhere else with that?
Do it again.
Yeah, again, just
Yeah, a little bit on the left side.
Okay, just there. So if you want to sit back down, you can. Just relax for me. So it's about what I would have expected with what your history and then what the MRIs and the imaging were there. So is that calming down?
Yeah.
Okay, good, good, good. Yeah, I know. I always hate it that it does usually elicit more pain when we're doing the physical exam.
I get that all the time with my pain doctor, and she does it. When I leave, I'm worse when I left before I got there.
Yeah.
But yeah, it's expected.
Yeah.
All right, next.
Any other questions for me, Michael? Concerns?
When are we going to start this?
Right now.
Cool beans.
That's the next thing. So we'll inject the low back and do the rest through an IV, correct?
Yeah.
Okay. So again, with the low back, we do a direct injection there. We'll do it with ultrasound. We do it in combination with a therapy called PRP. Have you ever heard of PRP or platelet-rich plasma?
Oh, yeah.
Okay,
You take
so-
the blood out and you centrifuge it,
Yep.
and then you add whatever it is you're going to do to it and put it
Yep,
back
so
in.
and that's basically what we're going to do is we'll do that quick blood draw on you, we'll spin it down, I'll actually add the exosomes into the PRP, that way we can just minimize the number of needle sticks injections that we'll need to do to the low back, because obviously with it just being a little bit of a bigger area, we'll have to go and just hit a few different areas, make sure we disperse it out. And then obviously the IV, it's just actually a quick push. It's not like we have a big bag hanging, because we do want to get the therapy, the stuff into your body so it starts doing its job and going to work.
So quick push.
With us. Yeah. So it'll be a quick push with that. So any questions, concerns on either of those two procedures?
Not right now.
Okay. And then with the low back, again, the injections, I believe I mentioned it to you earlier, but just to make sure, usually patients mention some pressure when the injection is occurring and maybe a very mild stinging sensation with the solution. Again, patients 4 to 5 minutes is usually the max that they experience that for. I've never had anyone even leave the clinic still experiencing that, but just want to give you a heads up.
Now, are you doing one injection in my low back? Because I have 3 injuries there.
It'll be multiple injections.
Okay, L4, L5, S1.
Oh yeah, because again, with just even you standing here just to put some pressure, but again, because we have both sides, obviously, that we even need to hit. So just even at that L5 level, we're gonna have 2 injections on each side. But yes, especially seeing your MRI and knowing where all that's at, plus the exam and what's going on in your legs, there's definitely going to be a few different places that we'll inject with that, so we can take care of it. Even just from the MRI, I saw your SI joint is starting to take some arthritic changes, inflammation in there. So I always just like to touch on those as well too, to make sure we just take care of them as long as we're back there injecting.
If you would. I don't feel like doing surgery down the road.
Yeah, we might as well take care of all of it for you then, Michael. So, well then we're going to go back into the first room, because that's where we'll do the blood draw and all that, just in that big chair in there. And I think
so you need this off then.
Yes, then I will need at least the long shirt off to begin with, because we'll do the blood draw and the push back to back, and then we'll spin the blood, and then we'll probably be back in here just for the back injection really quick.
All right.
Okay.
Then. So this is
8 units.
Is this what you're giving me?
Yes, this is what we're giving you right there. Yep.
So I can't just drink this?
No. We're gonna have to IV put it in. Yeah.
That's 20 million.
20 million. Yeah.
20 million living stem cells.
Mm-hmm.
Okay. Male or female?
They aren't anything yet. They're gonna turn into males.
They're gonna make their choice when
Yep. So I'm just gonna thaw these, and then we'll be good to go. Okay. So right arm, correct?
Yeah. And I didn't drink enough water, so slap that baby.
Come around. I was just about to ask if you've been drinking water for me or not.
Didn't drink enough water this morning. I didn't think about it.
Okay. No, we should be good. You had some pretty couple of good ones there, it looked like. So
yeah.
As comfortable as possible for you. So.
I experiment and I try to do anything and everything to ease up my discomfort.
Yeah, that's good. Just like to do the iodine just to make sure we got it nice and clean for you.
So I tell the cameras I'm breathing heavy because I hurt, not because I'm nervous. I hurt a little bit.
Poke. Let's just make sure we are in. We are good. Are you feeling anything?
Nothing.
Good, wonderful.
We put the needle in, a little sting there, that's about it, but that's typical. No, it's not painful at all.
And usually we describe it as a little bee sting. No problem.
Now my neck's hurting. Oh, my back's killing me, guys. I gotta stand up.
This one mixed really quick. We'll be done in just a second here.
Not no big, yeah. I'm fine with this.
Walk around in that, so.
Yeah.
Now we have the cells.
All right.
So you might feel just a little coolness as it's going in, maybe up the bicep just a little bit. Okay, yeah. Some people do, some people don't. So some people say they get a weird taste in their mouth. They aren't really sure how to describe it.
I have that. I got metal taste in my mouth.
So oh, okay.
That's from, I have too much copper and lead in me.
We'll just flush out that line to make sure all of those exosomes are in your body. And then I'll go spin the blood. And you can relax if you want to get up and move around then, Michael, just if that's going to be more comfortable for you.
It will.
You can, and then we'll be back in there for the injections. The PRP doesn't actually go back in the vein, so it's just used for, again, the local injection to the painful areas.
Okay.
And then I'll have you just apply a little pressure there for me while I get this. I'll get you Yeah, I know it. Just to make sure.
Yep.
But we'll get you wrapped up.
So you just had the IV push of exosomes directly into your veins. Other than the stick of the IV, do you feel anything in your body right now?
A little cold sensation in my right arm. That's it.
That's it. So like nothing else like that you're sensing. Just curious.
I'm hurting right now, but I was hurting when I got here. I live in constant pain 24/7.
And where is the predominant pain for you?
The only place that don't hurt is my left arm. Low back's the predominant.
Yeah.
Second would be the numb nerve pain in my left leg.
Okay.
Third would be my neck and my right arm.
Is there a cord injury? Like it seems like with
Many injuries.
Many injuries to your spine. So mostly spinal. So
To my L4, L5S1 from one accident. C5 was from another accident. The shoulders from a surgery, slap tear surgery.
Wow.
Many more.
And how long have you been experiencing this pain?
The low back pain was 02, and the shoulder was 06.
Wow.
The neck and the shoulder.
Besides the painkillers, what else have you done?
Cortisone injections, surgeries.
Any alternative stuff? Chiropractic, acupuncture?
Acupuncture. I do that still every 2 weeks. I do Myers cocktail every 2 weeks. I do chiropractor, usually weekly. It all tends to help out a little. It's all short term.
Yeah, just temporary relief.
Yeah, I do constant exercises, whatever. I mean, I used to be in a walker.
Wow.
The pain was so bad, and then I got on crutches, and then I got on a cane, and now I'm off of it, and I could actually do a mile on the treadmill now before the pain gets too bad where I can't do it.
So what caused you to say, okay, I'm going to try this therapy as compared to other things?
My mother did stem cell therapy.
She did. And good results for her, I'm assuming.
She had better results than what she was living in.
Wow.
She had lymphoma cancer. She was a brittle diabetic, 6, 7, 8 shots a day. And once she did the stem cell, within 35 days, her glucose, because they did the stem cell into her pancreas, she was down to 2 to 3 shots a day.
Wow.
And they said it would get better, but she died from complications of the car accident. And she was cancer-free after 13 months.
She was cancer-free?
Yeah.
Wow.
So
wow.
I do anything and everything trying to ease the pain. I've been on painkillers for 15 years. January last year, I started weaning myself off of it against my doctor's orders because the pain is so intense. So the last 3 months, January of this year, I'm down to a quarter pill on Saturday nights only.
What kind of painkiller?
Morphine.
Morphine, wow.
Yeah.
Okay, so serious.
Oh yeah, I went from Lortab's oxycodone, which I'm allergic to morphine.
Wow.
But I'm trying to live with the pain, and it's not no fun. You got to work, you got to make a living. They want me on disability. Can't do that. Can't live with disability. So I stay busy. If I stay moving, then I don't pay attention to the pain.
Right.
And when I sit after a few minutes, then I realize I'm hurting.
Do you have trouble sleeping?
Oh yeah, I get maybe 3-4 hours sleep a night.
And today's your first treatment?
Yep. I'm not going to have expectations. I just like to see some of the pain gone. I mean, the pain is less now since I got off morphine, because the morphine, as you know, you keep increasing the dosage because you become immune to it.
Right.
And so she wanted, seeing I was insisting off getting off of it, and I couldn't think straight being on morphine all the time, then get off of it and see if my natural body would take care of it. So on a pain scale of 1 to 10, I'm still between a 5 and an 8, depending on what time of the day or night it is.
Yeah.
Where before I was always a 9 or a 10. And if I took morphine, I'd bring it down to a 6 and never took the pain away.
Wow.
So,
well, I first of all appreciate you sharing your story. I can tell you that we've been interviewing a lot of people, a lot of patients, and I'm kind of startled by the results we're seeing. So I think you're in the right place. And
I feel I am.
Yeah.
I mean, I went through 8 inches of snow to get down here.
Snow? There's that much snow in Flagstaff right now?
Oh, yeah, they didn't even snow plow the roads. They didn't think anybody would come out. It was so bad.
Wow.
We went down the interstate and hadn't been plowed, and there was 8 inches of snow, just driving 30 miles an hour to get here.
Wow.
So I was going to get here one way or the other. I wanted to try this because I've been looking for this, as I was saying, based on my mom's experience.
Yeah.
So,
well, one thing is for sure, you seem very committed to finding a way to get better.
Yeah, I'm 65. I don't want to have to do surgeries a few years from now and not wake up from the surgery.
Yeah. Well, thanks for letting us film this.
So I'm just going to drape the ultrasound cord just across your legs there a little bit. That's what you're feeling there, Michael. First of all, we're going to get you all marked up. Went over just the MRI again really quick, but I always do like to know where you're having areas of pain as well. So we're going to start with that. So we're going to start on this right side. Just let me know. Pain?
Yeah.
Yep.
That's where I get acupuncture done.
Yeah, I was gonna say, oh yeah, a lot of these points will actually be could actually be very similar to the acupuncture points. Sore pain down here?
Yeah.
Right here?
No.
Anything? Right out there?
No.
But I'm still going to, just because there's some,
knots there, but
yeah, just because there's some landmarks I do want to hit as well. Anything across the iliac crest here? Okay. So just to go across. Now on this side, anything?
yeah, right there.
Okay, oh, that's a real one for you, huh?
Sorry.
No, you're
Got
fine.
off guard.
Right here?
Tender.
Tender, yep. And then how are we out here?
It's fine.
That's fine there.
Yeah, just knots.
How are we here?
That's tender.
Yep,
Tender
that's
more.
there, yeah. I do want to hit your SI joint. So I'll just mark that up really quick. And then anything along this iliac crest?
It's just light tender.
Light tender, so we'll still hit some there then. Okay.
Most of my pain is on the spine or to the right of my spine.
Mm-hmm. Yeah, I could just tell from those first few that we went through. So.
And the right side starts hurting a lot, then the left side joins in. You know, don't want to be single.
Yeah. yes. Now I'm just drawing up the exosomes into the syringe. I'll come back. I'll need to draw up a little bit more in the future.
That's a good thing I didn't eat chili last night.
Yeah, there's actually a lot of truth about the comedy for pain.
Laughter does make a difference. So I'm just cleaning you off right now with something called ChloroPrep. So here we go. So we'll start on that right side, okay?
Yeah.
So you're doing exosomes and PRP, or
And platelet-rich plasma,
Okay.
yes, the PRP. And then this is just going to be the ultrasound probe with the ultrasound gel on it. Cold spray for the needle stick, because we don't use lidocaine or anything like that, because that can potentially harm the stem cells. So we just use some cold spray for that. So a little bee sting.
I felt like a wasp. I'm kidding.
So here it comes.
Yeah, I feel it.
Feeling just some pressure in there?
Yeah, just pressure.
Yep. Good. Cold spray again.
Yeah.
You didn't even feel that one, did you?
Nope.
There we go.
That one's a throb. Ah,
That one's a throb.
that's shooting up my back.
Calming down for you.
Give it a minute.
Okay, cold spray again.
Yeah. Yeah, it went away.
Good, yep, it shouldn't last but that long. A little bee sting. So again, this is your PSIS. This is just where you have a lot of attachments
Yeah.
and that. So again, we always want to just go hit some of these landmarks, just knowing that there could be a potential issue
I hear you.
in those areas. Little bee sting. And then I'm just going to redirect the needle just to that SI joint as long as I'm in there. There's no need to come out. And there we go. Yep, I put a little bit more just down in that area for you. Just disperses out. So you probably just felt that a little bit. And then I'm just going to switch needles because I just have a few more exosomes to pull up. Okay.
Just it pinches.
Yeah, no, I can imagine. Yeah, that's why, again, try doing this as quickly as possible.
Don't worry about it. This is a good position here. This is the position I'm in when they do the acupuncture.
Last 2 injections, sir. There we go.
Actually, the low back's feeling better.
Good.
Is this acting like acupuncture as well?
It can a little bit, or even what's considered dry needling in that,
Yeah.
because we are doing multiple needle sticks, and very commonly, like where we did a lot of them on your back,
Yeah.
like right next to the spine, those are acupuncture points. Last cold spray. So a lot of the times you do just get sometimes that benefit of the stimulation to the acupressure points or acupuncture points.
So even though I'm feeling better right now, don't be strenuous for the next few days.
Even if you continue to feel like this for the next 3 days, because I would expect maybe later today, tomorrow, some of the soreness to come back in that.
Yeah.
Like we said, just take it easy for the next 3 days.
All right.
That's going to be the biggest factor. The main thing is we don't want to cause the back or those structures just any type of setback.
As far as, the experience of it, was it about what you expected or
I had
different?
no expectations. I didn't know what I was going to experience. I know my mother, when they did the stem cell therapy on her pancreas, they just did directly into her pancreas.
Yeah.
And that's all they were treating, was that and her lymphoma cancer at the time. They believed building the immune system up, let it fight the cancer.
Mm-hmm. So it seemed like it was not very painful what they just did.
Oh, there's nothing painful.
Not at all. Yeah.
I get acupuncture every 2 weeks.
So you're used to it. But these are bigger needles and going in a little deeper. Yeah.
Bigger? Oh, don't look, Mike, don't look. Okay.
Yeah.
No. It felt just like just doing acupuncture right now.
Yeah.
So you said feeling maybe a little bit of relief?
Like acupuncture.
Good.
So.
Yeah, because very similar type points, things like that. Yeah. So if you want to get up, I always just like being next to the patient, just in case there's some lightheadedness, dizziness, or anything like that. How you feeling? Are we lightheaded at all? Dizzy at all? Good, wonderful. How's the back feeling now for you?
It feels ache.
Okay.
Just achy.
Yep.
Actually, the pain on the left side is diminished, but there's still some pain on the right side. So
Okay.
You know how it is when you have a lot of pain and it's gone, you want to see if it comes back?
Yes, you're apprehensive. You just want to make sure. Yep.
That feels pretty good, actually.
Good.
Yeah, that's past my expectations.
Wonderful.
I thought it'd be hurting a little bit when I left here.
Yeah.
Okay, then. So, guys, I'm feeling pretty good.
Good.
Considering I thought I'd be hurting a lot. Leaving here, no pain, no gain.
Yeah.
No, you've hit the 25% mark right now. On the right side of my back, yeah, because I feel like I could bend over and touch my toes.
So what do you expect for him as far as when he might start noticing some improvement?
So this is a little common for patients sometimes to get up, but it's not always the case that they'll get up and say that they notice a difference already or that. Commonly when it comes to a low back like Michael's, we usually say about 4 to 6 weeks, but if he's already noticing something, we do have patients even in as little as 2 to 4 weeks. We'll start to notice improvement and pain reduction already.
Do you think what he's noticing is just based on the needle stick as compared to the actual stem cells or exosomes or PRP?
Possibly, that's usually what I chalk it up to, but there's evidence that they can work that quickly on inflammation.
Yeah.
And if it's reducing the inflammation, it'll definitely reduce the pain right off the bat. Right. It's not going to cause healing right away, but just with less inflammation, less pain.
Yeah, interesting.
Even just the next couple of days, I would expect some soreness in the areas where we did the injection a lot of times. Whether it's later today, tomorrow, patients will mention, I can feel the extra soreness, but it's where you did the injections.
Yeah.
That's, I would expect.
Okay.
If it's anything different, like you mentioned, going up the spine, obviously anything abnormal going down into your legs, definitely let us know. Give us a call before I reach out to you tomorrow. But again, I wouldn't expect any of that with how well you handle the injection and the treatment. So
if this works, is there times like years down the road I need to come in for seconds?
Well,
is this a permanent thing or?
My goal and hope is it's as permanent as possible for you. Whether it's a shoulder, a knee, if there's another area, because again, our goal is to have that back hold and stay well for you. And if we need to take care of something else, we can always address it at that time.
All right, I'm gonna keep that in mind because I'm a klutz sometimes.
Well, again, we did the IV push just before the injection, so you may start getting those things taken care of even from that.
Mason, thanks so much for taking your time.
Absolutely, thanks for having me.
Sure. So give us a bit of your background. Obviously, you're an athlete, and kind of what kind of injuries were you facing? What kind of pain were you in?
Yeah, I've had 7 knee surgeries. Used to play professional football. So
seven knee surgeries?
Yeah,
wow.
7.
Wow.
It was crazy. I've had microfracture surgery done, 2 ACL reconstructions.
Wow.
Yeah, so and the rest I call them oil changes, where they're just kind of taking out the fragments. So 2 hernia operations.
Wow.
And and then also I've had some concussions being a former football player.
Wow. So did that start in your high school years, the concussions? Or
I don't remember.
Yeah.
Was
people
little
weren't
joke,
really
right?
looking for it back then, right?
No, they definitely started younger, and the knowledge, not knowing what a concussion exactly was at the time.
Right.
If you saw stars, now it's classified as a concussion. So how many I've had, not sure.
Wow.
Yeah.
So your body's taken quite a beating, and football's a pretty brutal sport.
Yeah, it was or is obviously still. They're doing a lot to try to change that a little bit, but and I played everything. If there was a ball, I was around it.
Right.
It was a lot of fun growing up.
That's great. So what kind of, because you're young, obviously, to be, experiencing maybe aches and pains and having all these surgeries, but you're a professional athlete too, which, is kind of a package deal that goes with it. So what brought you to stem cells?
Well, I was up for a knee replacement at 28 years old.
Wow.
And I said, you know what, that's not where I want to go. I think medical advances will come around or what have you. And I just kind of dealt with it, lived with it for a long time, as a lot of my friends are doing now. And I actually married a medical lab scientist, and she was telling me about all the neat advances in stem cell therapy. And I had heard about different athletes and people that have gotten it done before. So I decided to look into it. And at the end of the day, I said, you know what, this is something that worst case, and if it doesn't work out, at least I tried.
Right.
And so I decided to do it, and it's been a very positive experience for me.
How long ago did you have it done?
I had it done 6 months ago.
So what were you feeling before you had it done as far as symptoms, and then where are you now?
Okay, well, yeah, I had excruciating knee pain. I wasn't able to go downstairs without holding on to the railings. I wasn't able to run anymore, hike anymore, do anything that really a 38-year-old should be able to do. So I decided that it was time for me to look into something. You know, I mean, even bending down to pick things up off the floor, to take a knee to fix something in my car, just around the house, not able to do it anymore. And it got so bad that I just decided it's time.
Wow. So you came in, you had it done. So where are you now as far as the knee?
Yeah, so I'm able to run on a treadmill. I just did an incline yesterday on my lunch break. I actually did some running, and I'm hiking. I'm doing things in the gym that I haven't been able to do in years.
Wow.
Yeah, it's really changed my life, and it's also changed the life of my wife, because we're able to do a lot more things together now, such as hiking, such as we love to travel.
Right.
So traveling can be kind of a pain, carrying things around and things like that. But I'm able to do it, and it's not nearly as painful.
Yeah, I think that's a part of the ripple effect, is that it's not only just, you and pain is less, so now life is better, but it really does have an impact all around your life as far as, where you can go, your spouse, how you can, do things together, etc. Did the results meet your expectations? Are they better than what you were expecting?
It's a great question. Everybody says they can fix my knee. Okay, everybody's told me that. So when I came to stem cell therapy, I wasn't expecting too much. I was just thinking, you know what? My wife says it's supposed to work out. I've heard a lot of great stories. Let's do this. And I was at about a 10. It was pretty painful, pretty excruciating, and I wanted to be down 30%. I was good at 30%.
Like just take the edge off, basically.
Take the edge off. Yeah. Let me do some of the stuff that I want to be able to do. Let me golf again.
Right.
Let me be able to shift my weight onto my knee. Let me be able to do that type of stuff that, like I said, a 38-year-old should be able to do. But now I'm down to a 5. Like I'm 50% better.
Wow.
And yeah, it's crazy. I didn't expect it. I'm super excited for it, obviously.
Yeah.
And I have friends and family now that are noticing activities that I'm doing that I haven't been able to do in a long time. So it's really neat to see other people take a notice also.
How long before you started noticing some difference in your knee?
In my knee, it was about a month. Now, I was the common term bone on bone, right? Even though I had some meniscus in there, the doctors would always say bone on bone. It took me about a month because of the degeneration that's been done in there, especially on the lateral side.
Right.
But once it started happening, and I took it easy. I listened to the doctors and said, hey, don't go out and go crazy just because you have stem cell therapy. Let them do their job.
Right.
So I was very excited to let them do their job, but then I really started noticing when I would do a walking lunge just to be able to see if it would work. No weights or anything.
Right.
And it was a little bit less pain. And then a month later, a little bit less pain.
Wow.
And then I got nervous to be able to try doing other exercises or maybe doing some hiking because, as you know, when you're hiking, on the way down can cause a lot of load, right? That's the tough part. But I started testing things out, and then I would be more sore everywhere else in my body because I haven't done that in a while, but my knee wasn't swelling up anymore.
Wow.
Yeah.
Wow. Well, that's interesting, too, because the pain is one thing, but of course, that's many times accompanied by swelling.
Yeah.
And you're saying that the swelling was reduced also, or you weren't seeing swelling?
Yeah, there wasn't any swelling.
Wow.
That was the most powerful thing for me. Because with swelling, if I wanted to do something prior to my stem cell therapy, it was a sacrifice. Like, let's say I wanted to try to go skiing, and this is years ago.
Right.
I would know that it was going to be a 3 to 4 day recovery just to be able to feel normal again.
All right, you had to pay the price.
Pay the price, yep. Yeah. Had to sacrifice a little bit.
Wow, and I guess, because normally people having knee issues, they're decades older than you.
Right.
But at your age, this is the time when you're supposed to be enjoying all this stuff, especially, right?
Yeah.
So pretty amazing results. Is there anything else you noticed? Because you obviously your body's been beat up from professional sports. Is there anything else that you've noticed that changed in your body other than your knee?
Yeah. Along with my knee pain, I was also having a lot of tendonitis issues in my wrists and my elbows. Mm-hmm. And to do a lot of the daily tasks that we all take for granted, especially at 38 years old, was getting annoying too. I didn't really notice it going away. My wife did, actually, because she noticed I wasn't cracking as much. I wasn't asking her to do some things that usually I should be able to do.
Right.
And that was nice. And then I realized, wow, my tendonitis is gone. In the gym, I'm able to do a lot more things. Right. Obviously, if your tendonitis in your wrists and elbows are gone, you can do things like that. So I call it the side benefit of having my knee injected, and the therapy into my knee has been phenomenal.
Well, and this is interesting because a couple of people have mentioned this almost the same way you did. It's like they started to notice, or they didn't notice, that pain was gone in other areas until they remembered, oh, wait a minute, this used to hurt, and I'm realizing I'm not having this type of pain anymore. Right. And I guess, because a lot of times people would say maybe this is a placebo, maybe it's in your head. I think as extreme as your pain was, et cetera, we could rule that out.
Right.
But when you're not expecting these other things, that also sort of lets credence to the fact that there's things going on that we're not just believing, but are actually happening and having an impact.
No, you're right. And with the placebo effect, I didn't really feel anything like that because, like I said, it was about a month in my knee until it started feeling better. So any kind of real placebo effect would have been gone anyways.
Right.
And I understood it was going to take some time. Right. But yeah, the other things that have been benefited from it, and like you said, the things that I don't know that could be happening, like my heart, my organs, my brain, so the plaquing going on in there. We as former football players have a lot of plaquing going on. So hopefully it's doing its job up there, but time will tell, obviously.
Mason, I understand you're not the only one in your family who got stem cells. So your wife got stem cell therapy also?
Yeah, she did. We were getting my treatment. I was getting my treatment in my knee, and we were talking. And she understands, being a medical lab scientist, about how stem cell therapy can work. And we were having a problem ovulating, and that's a hormonal issue at times. And so we decided to go ahead because she also has heart disease in her family. Her father passed away of a heart attack at 62 years old. Wow. So we decided to be proactive with it. And yeah, it's been really crazy. She hadn't ovulated and hadn't had a regular cycle in years. Ovulation, like regular cycle in like 10 years, but ovulation really ever.
Wow.
Yeah, so we decided to put her through stem cell therapy, and she just did, the IV, and we were able to, so we're ovulating now. And it's about 3 months. 3 months later, she started ovulating.
Wow. So literally after never having ovulated.
Yeah.
And that's really interesting because now you're kind of extrapolating, saying she didn't have any real pain, but you just knew of this hormonal issue, through, I guess, examinations.
Yeah.
And then they just did kind of systemic, just an IV injection.
Yep, that's it.
And 3 months later, it's happening.
3 months later, it's happening. We actually got pregnant. And then we lost it, 6 weeks later. But we kind of knew that she was high risk to lose the first one.
Right.
And but we're super positive. She then ovulated again the next time.
Wow.
So yeah, we're really excited for the future.
Wow. So that was probably something you didn't expect when you were getting your knee handled.
No. It definitely was a combo deal. She, being the medical lab scientist, wanted to see how everything's done.
Yeah.
She was just curious. And when we were talking, we're both a glass half full type of people.
Right.
And so we're talking with the docs, and they're having this medical conversation.
Right.
I don't really know these words they're throwing out pretty much.
Right.
But they're having this medical conversation, and I just felt it. I said, you know what? You're getting on this table next. We're getting treatment for you too. And she got really nervous because she's never had the treatment either.
Right.
But it was a simple process for her, and she's obviously, we are really excited.
Well, I'm looking forward to your future family.
Yeah, thank you. Hopefully another one of her. I don't know if they need another one of me, but we'll see.
That's
thank
great.
you.
Well, that's quite an extraordinary story. Really happy for you to get all this activity back, and thanks so much also for just sharing it with us and letting people know about it.
Yeah, absolutely. Thank you. It's been an awesome experience.
Glenn, thanks so much for sitting down to speak with us. Tell us about your health history. What are you challenged with?
Well, before I came to the stem cell clinic, I was really having some serious problems. I had my oxygen concentrator up to 5, and even at that, I couldn't walk very far without having to take 15 or 20 minutes to catch my breath again. And I have a lot of things that I'm still trying to do. I've been hunting and fishing for most of my life, and I had finally said to my wife, I says, I don't think I'm going to be able to go hunting and fishing anymore, because I was so bad with my breathing and stuff. And took the treatment, and geez, I feel a lot better. I'm not cured by any stretch of the imagination, but I think it moved me backwards about 4 or 5 years. And so I'm looking forward to going fishing. I bought a new motor for my boat. and
So the device you have with you that's making this noise is an oxygen concentrator.
Yeah.
So it helps you get oxygen wherever you go, and it's convenient that you can take with you.
I can take, a lot of times, I can go to a meeting or something like that, and if it's going to be a long meeting, I'm in the Special Forces Association, and I edit their, in fact, I pretty much put together their bi-monthly newsletter. And I go to 4 meetings a month with these guys, and a lot of times they're fairly long, and my oxygen concentrator won't last that long, so I go ahead and just turn it off, and I can sit there and talk with them without a problem.
What is the condition that you have, though, that makes it difficult for you to breathe?
It's called COPD.
COPD, okay. So how long have you been struggling with COPD?
Probably about 10 years. May have had it before then, just it didn't slow me down that much. But for about 8 to 10 years, it's been getting gradually worse and worse and worse. And I've been on oxygen for about 8 years now.
Obviously, it's difficulty breathing with COPD. Are there any other symptoms you have? Is there any pain or discomfort associated with it?
I get extremely hot when I'm short of breath. But no pain really. It's not painful. It's just can't breathe.
Yeah.
And that's probably one of the most important things that you can do. If you don't breathe, you don't live.
Yeah, that's for sure. So what caused you to pursue cell therapy as a possible solution or to help you?
Well, I heard about stem cell treatment, and I went to Dallas, Texas, to the Lung Institute, and they drew out about 120 cc's of bone marrow from my hip, and then spun that down and then re-injected it into me. And I don't think that did a damn thing. It didn't seem to improve my condition at all. Well, my brother called me up and told me about this embryonic stem cell from umbilical cord and from the placenta. And I said, well, that's probably work a lot better than old stem cells from me. And he says, well, I got nothing to lose, really. And they're offering it as a for military for a one-time treatment for free. And I said, well, can't beat that deal. And if it doesn't do anything, I haven't lost anything.
Right.
And if it helps, it helps. And so we came over and got the treatment, and I am just ecstatic. It's so much better. I feel so much better, and I think I'm going to end up getting another treatment in about 6 months.
So was the effect immediate? How long before you started to notice that there was a change?
They gave me a big inhaler, and I used that. And later that afternoon, I went to my brother's house, and we were going to spend the night there. And I started coughing and hacking and having all kinds of problems. And my breathing wasn't real good. And then I had my wife check how my lungs sounded. And she said, well, they sound real good. So I got them checked again, and they're clear. Before, they were a lot of what they call rales and rhonchi, which is noises and gurgles and all kinds of wheezes and stuff like that inside your lungs. And that was what was normal for me. And now, a lot of times when it's completely clear. Yeah. Although I did catch a cold a couple of weeks ago, and I'm still fighting the effects of that off. But other than that, I'm doing great.
So it's interesting because there's obviously different forms of cell therapy, and you had one that didn't really work for you at all, and then one that you said was completely noticeable and that your quality of life improved. Yeah. How long ago was it that you had the last cell therapy?
It was the 12th of December. I came over here and had it done, and
about 2 months.
Yeah, only a couple of months ago, and so it's probably going to continue to improve as far as I know. Yeah. And they said it's going to be anywhere from 2 months to 6 months of improvement. So I'm just in the early stages of this, and I'm ecstatic already.
Wow. So what does it mean to you to say, wow, there's a pathway maybe for some better health or some hope for me?
I think it's great. I'd like to stick around a lot longer. And I like doing the newsletter for the Special Forces Association, and I sure love my hunting and fishing. And I'm glad I'm back on the line here to go hunting and fishing instead of just sort of continue to fade down. I figured it would be 6 months to a year, and I wouldn't. My wife and I both talked about that, and I figured that I wasn't going to last much more than that. And now I think, I got a few more years to add to that.
Well, and do you think that helps with the healing process when you can actually do things that you enjoy or the things that matter to you? That kind of turns the whole momentum of your health around, I'd imagine.
Yeah, I was getting pretty depressed, I guess. I was just thinking, well, I don't need to do this, I don't need to do that. Because anytime I went and did things, it was really difficult. Mm-hmm. And just recently, I have a complete reloading set in my house, and I have a son-in-law who got a 30-30 Winchester for Christmas, and he wanted to know about reloading. And I said, well, we got the dies and everything right here. And I brought him over and showed him how to do that. Before, I wouldn't have been able to do that. Because I wasn't interested in even going in and reloading my own shells because I just didn't feel up to it.
Yeah.
And now, we've had a good time reloading shells and stuff. He's got 4 kids, and he's brought all of them over there and taught all of them how to reload. And so it's been a lot of fun.
Well, when I'm looking at you, you seem to have a lot of energy right now as you talk about these things. There's a level of excitement.
Oh, yeah. I'm very excited about this. I'm very happy with this, pleased with this.
You have a military background?
I did 23 and a half years in the military.
Wow, what branch?
16 and a half years as a Special Forces medic, and then I went to Physician's Assistant School and spent the rest of my time as a PA. And while I was there, as a Special Forces medic, I wrote a handbook, the Special Forces Medical Handbook. That was been pretty much of a bestseller for about 30 years.
That's great. So you have a background then in medical care.
Oh, yeah.
So it's interesting because you come from then that background in the military, in medical care, and you're challenged. COPD is obviously a very challenging condition, but you're willing to explore, I guess, new possibilities to help you.
Well, what do I have to lose? I'm on the way out right now, so if I get anything out of it, it's a plus.
Yeah.
And I was surprised how much I got out of it so soon.
Yeah.
And like I said, it's 2 months into the treatment, and they said anywhere from 2 to 6 months. Well, mine started within a few days.
Wow.
And I'm really happy.
Well, I'm happy for you, and I wish you continued success with your treatment, and that you continue to get better and do the things that you love to do in your life.
Yeah.
So thanks very much for taking the time.
You're sure welcome.
Pretty fascinating stuff, huh? I really love talking to patients. I really like looking at the procedures, and it kind of brings everything together. So thanks for joining me with that. Well, that does it for episode 2. Thank you again for being here with us. I want to remind you that our mission is very sincere and very serious with Pain Revealed. We want to help people who are challenged, who maybe are getting toxic with the drugs they're taking, trying to combat their pain or solve their problem. We've explored many different innovative and new and cutting edge views on how people can address their challenges when it comes to pain, whether it be acute pain or chronic pain, and have solutions for them. They're actually healthy solutions, different solutions, alternative solutions. That's what this is all about. So please help us in our mission. Share this with people you know. We are now building momentum episode by episode, so it's a great time to join. Again, I want to thank you for being here, and thank you for sharing our purpose and mission in Pain Revealed.
Any physician that claims to want to solve pain is misunderstanding the problem. What you need to do is use pain to find the problem and then solve the underlying problem. You can't just keep treating pain. Pain is not the problem. Pain is the symptom, it's the indication. It's giving us information where we need to go and where we need to look.
You have chronic pain. Typically it's neurotoxic. You have to look there because even if you end up being properly diagnosed, the greater mistakes happen on the back end. Is how do we get rid of it?
I've had this really nagging back injury since about September of last year, and I have done almost everything I can think of for it, and I continually re-aggravate it and cause more problems. It's messing with my quality of life in a big way, for sure. I had exostomes, I think, injected into my back. For anybody who would be concerned with needles, like, this was very easy. I'm stoked for the future now.
I think when you have a chronic health issue, it's with you every day. It's always working on you if you know it or not. And I think it creates just a little bit of grief and loss in your system. Regan eventually suggested I try stem cells in my neck. It took about 3 months, but then I did feel a very noticeable difference in the pain.
And 3 years later, you're still noticing that the benefit is there?
Absolutely.